2, 1, and we're live, ladies and gentlemen, or gentlemen, you two, ladies and gentlemen listening, but you two, unless you have some non-binary handle that you enjoy, it's a new world.
I don't.
Please introduce yourself.
Sure. So I'm Dr. Mike Hart, originally from St. John's, Newfoundland. Now I'm residing in London, Ontario, and I'm a family doctor. And I've been practicing cannabis medicine for just over 5 years.
And use her.
My name's Alex Berenson. I used to be a New York Times reporter. Then I became a spy novelist. And most recently, I wrote the book Tell Your Children, The Truth About Marijuana, Mental Illness, and Violence, which came out last month and has not endeared me to the cannabis advocacy community, I'd say.
Have they attacked you mercilessly for this book?
Yes, they have,
Yes.
and that's okay. I've also heard from a lot of parents, some users, but parents who've told me that the book really encapsulates their family's problems in the last couple of years.
I suspect my real thoughts here, before we even get started, is that we're going to find that the truth is somewhere in the middle here. I don't think marijuana is 100% safe, honestly, for everybody. I really don't. I know too many people that have had experiences where they took too much, particularly edibles, and I want to say I know anybody who had psychotic breaks, but I know some people that freaked out for weeks. In fact, we just had a comedian here from Brazil a couple days ago, Rafi Bastos, who said he took a couple of hits of a vape pen. He was high for 14 days. Went to a psychiatrist, and he's a big guy. He's like 6'5", 6'6". And they told him to keep taking it because he's like, you're so big, just keep smoking. And so he doesn't smoke, so he just kept hitting his vape pen. He said, I was high for fucking 2 weeks.
Yeah, so you need to do it properly, right?
Yes.
It needs to be held to the same standard as any other medicine. So we need to identify that there's risks and there's benefits to it.
Yes.
Right? And some people are definitely, going to be more susceptible to those risks.
Yeah.
And we need to kind of, tease out those people and make sure that those people, don't put themselves at risk.
Yeah, I think so as well. And this is one of the reasons why I want to state this, because I'm a well-known marijuana advocate. But I believe absolutely there are great benefits to it. I think there's great benefits in terms of relieving pressure, ocular pressure for people that have glaucoma, people with AIDS who are on medication, people with cancer that are going through chemotherapy find great benefit in terms of helping them. And then there's also some people with autism. I know people that their children have autism and they give them small amounts of edible marijuana and stop seizures. It's incredibly beneficial in the form of CBD for a lot of different ailments. But I think with all things, and this is a stance that I've kind of like really come to accept over the last few years, with all things that affect the mind, they affect everyone slightly differently.
Absolutely. Yeah. Alex, you want to say something?
No. Well, first of all, I suspect, there are people who said, don't go on with Joe. He's just going to, he's going to try to eat you alive. And especially it'll be 2-on-1. I told them the truth. First of all, I'll go on with anybody. And I am glad you had me on, or you're having me on, because, Bill Maher, he won't have me on. He's afraid to talk to me about this.
Why? What did he say?
Well, he told his people told the Simon & Schuster PR people, we just don't want to have him on. And NPR had a national NPR show had an interview scheduled with me, an hour-long segment, and they canceled it. They said we don't believe in the conclusions of the book. Okay, you don't believe in the conclusions of the book? Have me on. Ask me anything.
Yeah.
And that's why I'm so happy that you're not afraid to have me on, that we can have a conversation, Come at me with any question you want about the science. I'll say right off the top, I don't think marijuana is medicine. It has a few medical uses that have been, CBD has been shown to reduce seizures in kids. That's great. THC has been shown to reduce the nausea associated with chemotherapy. That's nice. But for the most part, people use THC and cannabis as recreational intoxicants. They use them to get high the same way they use alcohol, the same way they use other drugs. And the sooner we accept that reality, the better off we'll all be. That this is a drug and it has risks and benefits. And the risks and benefits are different than alcohol. They're different than other drugs. But I don't think if you look sort of on a population level basis, they're less than alcohol. I don't think you can even say that.
I really strongly disagree with that. And I mean, you just have to look at the death rate, right? More people die from alcohol than, almost all drugs combined. But when we're looking at cannabis, there's 0 deaths attributed to the use of cannabis itself. Sure, you could say, someone could use cannabis and jump off a cliff or something like that. But we're talking about the lethal dose. You cannot die from cannabis. And just based upon that alone, it makes it much, much safer than alcohol.
Yeah,
So
how could you say that if that is the case?
So that's a really good question. The normal number that's used for U.S. deaths from alcohol is about 90,000. Now, about 30 to 40,000 of those deaths are deaths from the physical effects of alcohol, right? Essentially liver damage, either chronic liver damage, you get cirrhosis, you die. In some cases, you can drink so much that you kill yourself in a night. So that's about 30 to 40,000 deaths. The other deaths are generally associated with alcohol, meaning somebody
Violence.
drank. Exactly. Violence, suicide, car accidents. And all those numbers are basically based on studies from the 90s and before, where people looked at traffic accidents and there were a certain number of those accidents where people had a blood alcohol content of higher than 0.1. They said, okay, that's an alcohol-associated death. That's a fine way to count as far as I'm concerned. Nobody has ever done that count for cannabis, and I can tell you based on the tox screens that I've seen from Colorado, where people had cannabis in their blood and committed suicide, people had cannabis in their, or I should say THC in their blood, and got into fatal confrontations with police officers. If and when we do this number for cannabis, which we need to do as soon as possible, the number is going to be a lot higher than 0. I suspect it will be in the 10 to 20,000 range. We won't know till we actually do it.
Okay, but let's eliminate. Let's go even over the alcohol. Let's eliminate all things like violence, and let's eliminate suicide, and let's assume those people would have committed violence and committed suicide without it. You're still looking at a giant number of people who drink themselves to death.
Yes.
Thousands and thousands and thousands of people every year versus 0 with marijuana. And you're aware, I'm sure, that correlation does not equal causation, and that especially in a place like Colorado, where you're dealing with cannabis, something that stays in the system for many, many weeks, if you're testing people and they test positive for marijuana and they wind up committing suicide or they wind up committing violence, they don't even necessarily have to have been under the influence of it.
Well, as you know, there's when you test the blood, you can test both the active metabolite and the inactive metabolite
Right.
of THC. So the test, when you do a blood test on somebody who's committed suicide, it's sophisticated enough to tease that out. So there's a lot of people who have the active metabolite in their blood. I agree. Alcohol is a physically toxic substance. Cannabis is a neurotoxin for a lot of people.
But in addition to the deaths, there's also just the morbidity that's associated with alcohol. I mean, it ruins people's lives. It ruins marriages. It leads to weight gain. It leads to a lot of metabolic disturbances.
I think you
right?
could say that for some people with marijuana too. I think you could say some people, especially weight gain, that some people smoke a lot of pot and they get lazy and they start eating Cheetos all day. and you could also say that with some people, the wake and bakers that, seem to be wasting their lives away. And that's like the stereotypical negative, when you're talking about a negative description of a marijuana user, it's the wake and baker, right? The person who's high all the time. You could absolutely say that could ruin relationships. You could absolutely say that could ruin your job.
You could, but again, too, we're using the term marijuana, and really we should be using THC or high THC when we're saying that.
Okay.
Because, people who use high CBD every day, as we know, or most people listening to this probably know that CBD is non-psychoactive. It does not get you high. So,
super beneficial.
That can be extremely beneficial for, a variety of different disorders that people have.
Yeah.
So, we really need to be careful about using cannabis versus using, THC, because it's really the THC that can do that. And to your point, but you say like THC can cause the munchies, and of course that's not good for someone who doesn't want to gain weight. And just so people know, the way that it does do that is when THC attaches to the CB1 receptor, you get an increase in a hormone called ghrelin, and ghrelin can actually induce hunger, and that's why people get the munchies. But that is not necessarily a bad thing if you're someone who has cancer, or if you're someone who's wasting away from a terrible illness. So sometimes having the munchies is definitely a good thing. And I know a lot of people have said to me it's not available, so you should probably not talk about it as much, but there is another cannabinoid called THCV. So, there's over 100 cannabinoids in cannabis. THC and CBD are only two of them. Those are the main ones that people know about. So THCV has been shown to actually reduce appetite. So if we can get that out there in the market, like we have with CBD, then we can almost, eliminate or potentially, substantially reduce the problem that people have with THC by using it with THCV.
Dr. Hart, I have a question for you. When people come into your practice, do they want high CBD products, or do they want to get intoxicated?
No, absolutely.
Well, in Canada, it's fully legal.
Sure, of course.
Yeah, so it's like if they don't need to go to him to get intoxicated.
Right. So you're seeing a population that is genuinely interested in the health benefits.
Absolutely, because I'm glad that that's legalized in Canada, because it does make my job a little bit easier, because basically everyone who's coming to me now, I know that they want to use it medically, because if they want to use it recreationally, they just go to the store, right? Because it's kind of a pain to, get in to see me, come in and have the discussion, all that type of stuff. So, the people who see me now, they're all using it medically. And then, to answer your question though, Alex, almost all my patients, as soon as they come in, they say, I don't want to get high. I don't want to get high. Like, that's almost what everyone says. So, I think the word is out there that, CBD is non-psychoactive and it doesn't get you high. And I think that a lot of people are really interested in that compound. And, if the people didn't have the success that they've had over the past few years, it wouldn't be as popular as it is. So, I think that we do need to look at the scientific evidence, but we do need to listen to others. And the anecdotal evidence is, something that we should consider, because it is so strong.
Alex, let me ask you this. Why don't you consider it medicine when it has proven medical benefits?
Well, it obviously can be medicine for these narrow things that the FDA has approved it for. But as you know, I'm sure, when people talk about it as medicine, when the ballot initiatives that have gotten it approved as medicine have really essentially deceived voters about the process, right? So you go to a pot doctor, you get an authorization. That authorization essentially enables you to buy as much cannabis as you want for the next year. Most of the time, in reality, these doctors are not giving you a real medical examination. They're saying to you, hey, do you have pain? Do you have anxiety? Here's your authorization.
Mm-hmm. I don't think you should speak for every single doctor.
No, not
because
every. No.
We don't do that at my clinic, and I know that a lot of the clinics in Canada, anyway, we definitely do not do that. And we provide a lot of education at my clinic, and there's other clinics in Canada that also provide a lot of education.
And I imagine there's a spectrum, but in the U.S., this was and I spoke to advocates for my book. I spoke to Rob Campia, who ran the Marijuana Policy Project for a long time for the book, and he acknowledged, the advocates knew that this was a backdoor route to legalization in the U.S.
Yeah, I used to joke around about it.
Yeah.
My doctor said, why do you eat pot? I said, I get headaches. He said, when do you get headaches? I said, whenever I think about the fact that pot's illegal. So he wrote me a prescription.
I mean, let's be honest about it.
Yeah.
I'm not look, I say in the book at the end, I don't think this substance should be legal. I favor decriminalization. We're sort of jumping ahead here. But if it's going to be legal, I'd rather have it be legal for recreational use. I'd rather that we don't pretend that THC high cannabis is a medicine, and I'd rather separate out doctors like Dr. Hart.
THC is a medicine, though.
But why are you saying don't pretend? Because there's many medicines that have horrific side effects.
Sure.
The medicine THC in regards to children's autism is pretty significant and well documented. Epilepsy, autism, those are two huge things that happen with children that they've been shown to severely mitigate with edible marijuana.
So I have to push back on you a little bit. CBD has been shown to reduce seizures in children with epilepsy. It's FDA approved for that.
May be anecdotal, but I have a good friend who has a child who he uses it on, and he showed it. It's been a game changer.
Yeah,
so
let me interrupt for a sec. So, I had a patient 4 or 5 years ago, and she was 20 years old. She couldn't drive a car because she had seizures, right? So you can imagine being 20 years old, not being able to drive a car. All your friends are driving around. So she uses a little bit of CBD, not even every day. She's never had a seizure since.
Okay, but I
and
think
now she's able to drive her car.
But we're talking about CBD. He's talking about THC.
So you're talking about a case, okay? And I'm not saying that your friend's situation didn't happen. I'm not saying it's not real. What I'm saying is that the reason we have clinical trials is because science, the way you know whether a medicine works or not, whether a chemical compound works, whatever that compound is, the best way to know is you give it to two groups of, you give the real medicine to one group of people and you give a placebo to the other group. And you see the changes in those two groups over time. And you find out whether or not your theory about whether this works on a population level basis is real or not. That is at the core of medical science. And we've basically thrown that rule out for THC.
Well, that's not entirely correct. You do know that were studies that were run during the Nixon administration that showed the efficacy of marijuana and the safety of it, and those were all squashed. And you also, I'm sure you know, like when we're talking about marijuana, you're talking about something that's federally illegal. It's not something that's easy to run these FDA studies on.
Yes, and I do, and I say at the end of the book, I think we should drop that. I think anybody who's got a legitimate interest in researching either THC or cannabis or any of the compounds for a medical condition, let them run phase 1, phase 2, phase 3 trials. Let's see if this plant is good for these things.
I think that's a great idea, but still, why are you saying that you don't think it is medicine when all these people find benefit in it?
So
do you think they're getting it from just the CBD, the minimal amount of CBD in marijuana?
No, I think that again there's been a lot of research done on THC and cannabis to see whether or not whether THC is a compound and whether smoked cannabis can treat these conditions. And for the most part, the studies have been negative.
Negative in what way?
Meaning they haven't shown any actual
Can you cite these studies?
I mentioned them in my book.
Okay. Well, what were the conclusions of these studies when you're saying that they're not positive?
That they didn't work. That the drug
didn't work on what?
On cancer, on Alzheimer's disease, on irritable bowel syndrome, on all kinds.
So, Alex, I mean, you're throwing a few different things out there, and I appreciate the fact that we can't be going around, saying things like, cannabis cures cancer, right? But I, and I've done videos on this even like recently, stating that. But if you look at the research, I mean, specifically, if you look at specific cancers, there are studies that have shown that THC and CBD can help. Like, say if we're talking about breast cancer, and I did a video on this recently, if you are HER2 positive and you use THC and CBD, it can in fact reduce tumor size and it can reduce tumor growth. Now, if you have
I'm sorry, can I interrupt you? What does that mean? What is it?
It's a subset of breast cancer.
Right. So there's different types of breast cancer, and that's just one subset of breast cancer. So there are other breast cancers which do not express cannabinoid receptors. And I've seen one study, at least, again, it's only one study, that showed that when they gave THC in that animal model, it actually caused a proliferation of tumors. So it worsened them. So, I do agree with you, Alex, in the fact that, we have to be careful about using, terms like that. But that just doesn't mean that we can't say that cannabis is no good for cancer at all. And I mean, even in the National Academies of Science and Engineering report, they said that cancer was great for chemotherapy-induced nausea and vomiting, right? So, it's definitely a really good medicine for a lot of different things. And when we're talking about THC, I said earlier, of course, we need to be careful about THC, but it definitely is still a medicine. And to your point with regards to it not being a medicine, say for something like PTSD, I come from it from a clinician's point of view. So I'm not a researcher. So I need to make sure that my patients are getting better. It's very frustrating for me just to say to someone, "Oh, there's nothing I can do for you. There's nothing I can do for you." So, and I understand that doing something sometimes is not going to be beneficial just because you're doing something. You have to do something that actually works. But, we do have epidemiological studies, and we have other studies that have shown that, when patients are given cannabis, it can reduce their symptoms of PTSD. There's also another study, I don't use this drug too often, called Nabilone. So Nabilone is just pure THC. Nabilone was shown to reduce nightmares in people who have PTSD. So, it's just saying, just because THC is psychoactive doesn't mean that it's not a medicine. And just to keep on the topic of PTSD, in addition to that, we've identified mechanisms of action. I know there's one study. I think Matt Hill was on the was one of the authors of that study, and he noted that in people who have PTSD, there's an over 50% decrease in levels of anandamide. So anandamide,
which is the naturally occurring cannabinoid in your brain.
Which is a naturally occurring endocannabinoid, correct. So you can get that through exercise, which is one excellent way to do it. And that's part of the high that you get after you exercise. But the other way that you can get it is by using cannabis. So when THC attaches to those CB1 receptors, you can get a release of anandamide, and cannabidiol can actually increase anandamide by another mechanism of action as well. So there's different ways where we can raise a level of deficiency. So to me as a clinician, if I have someone who is not doing very well, they've been on a bunch of different medications, I've identified that they have PTSD, we have a mechanism of action, we have studies, and then again too, don't discount my clinical experience, right? I've been working for over 5 years, just with cannabis. I mean, I do other medicines, prescribe other medicines as well, but I've been doing cannabis medicine for over 5 years, and there's a lot that I've learned, right? So as much as I've learned, through reading studies and through going to conferences and things like that, for sure the best resource as a clinician is to learn from your patients and to hear what your patients tell me. And the things that my patients tell me is that THC is really effective for their sleep at night. And a lot of my patients, especially my veteran patients, have done really, really well with that. And just one further point too, there was, I know it was in 2015, I believe it was, there was a meta-analysis done, I can pull it up if we need to, that indicated that, a lot of the medicines that are being used now for PTSD are just simply ineffective. And the other thing too is that there's never been a medicine made specifically for PTSD. So all the medicines that people are using are for anxiety, or they're for depression, or they're for insomnia, or they're for something else. But when we look at like a study that says people with PTSD have a lower level of anandamide, and then if you can increase that level of anandamide, that's a good way to treat someone. It doesn't matter whether it's a vitamin, whether it's a hormone. As long as you are correcting a deficiency, you're generally going to get excellent clinical results.
So let me sort of try to frame this a different way. Alcohol reduces blood pressure. Okay, alcohol generally tends to reduce cardiovascular events for people. And during Prohibition, you could actually get a doctor's note for alcohol as a medicine. But alcohol is not a medicine. Okay, it's a recreational intoxicant. It has some positive biological qualities and some negative biological qualities. And, there was an argument, I think, 10 to 20 years ago, should we recommend that people drink moderately, 1 to 2 drinks a day? And I think for the most part, the medical profession has come down on the side of saying, let's not do that. There's too many non-cardiac negative side effects with alcohol.
Just on that note though, Alex, in Canada right now, I know the safe alcohol drinking guidelines are 14 drinks a week for men and 9 drinks a week for women. So,
right. So
basically two a day for men, 1.5 for women.
Right. So you're saying, okay, like we don't see huge negative consequences at that level. Okay. That's fine. Like that's a totally reasonable way to think about alcohol. But what we're not saying to people is this is a medicine. And I think that's where the confusion around really around high THC cannabis lies. And again, I don't mean to say that your friend's child is not benefiting. If you say he or she's benefiting, I believe you. What I'm saying is that that's not good enough for science. We need randomized controlled trials. And when those trials have been done, and a lot of them have been done, Joe, a lot of them have been done, they've almost unequivocally shown that cannabis doesn't work as a medicine. The only actual place where, beyond these sort of very limited conditions like chemotherapy-associated nausea, which obviously is terrible for people who have it, but isn't that common, fortunately, cannabis has been shown to work as a pain reliever, right? Probably for the same reasons that alcohol works as a pain reliever. It sort of dulls your awareness of your pain. But even in that study, or even in those studies, they're mostly done against placebo, not against opioids or against NSAIDs like ibuprofen. And there was a very big study for cannabis use in chronic pain over a multi-year period in Australia that came out last year that showed that people who used cannabis had more pain and used more opiates at the end of 4 years than people who didn't. We're almost arguing about what medicine is.
Yeah, that study, though, had a lot of flaws in it. And the other thing is that you need to look at someone who is already using cannabis versus someone who is just using opioids. So if someone is just using opioids and they want to come off cannabis, there's multiple...
Come off opiates?
Come off of opiates with cannabis. Multiple studies have shown that can be effective. And that's not what was done in the Australian study that you're referring to.
Right, it's a more naturalistic approach.
Right, and also too, they didn't have access to medical marijuana during that whole time.
Right, so
those are all self-reported,
right.
And they were getting it from recreational sources.
Sure.
They weren't getting it from. That's a big distinction, though, right. Alex. Like they weren't getting it from a doctor who prescribed it to them. They were. This was a self-reported study, and people were getting cannabis that they didn't really know what they were getting. It wasn't. They weren't given any information from a doctor, and that's why it's a medicine, Alex, because you can tell someone, you can tell a patient to take a certain amount of CBD every single day. And when you take a certain amount every single day, it can reduce your symptoms. And sometimes you need to increase that, and sometimes you need to decrease that.
I think we should
do that with all medicines.
We should be really clear about the distinction, though, between CBD and marijuana. I mean, we're really talking about the psychoactive version of it, right. And this is where you're saying it's negative.
Yes,
you're not really arguing that CBD
I'm
is
not.
is
and I think Dr. Hart is talking about using this as a medicine. Certainly using the CBD. He's titrating his patients. He's monitoring them. He's not writing them an authorization and saying come back in a year when it's up. He's being a physician, and and I think to the extent that marijuana is medicine, we want people like him.
So you admit it's medicine?
No, I don't admit that.
But you just said that.
I don't think I just said that. I think I said to the extent. I'm trying to meet you halfway, but okay. I'll stop doing that. But I think you said something else that was really interesting to me, and this came up in the book too. So you're a clinician. You see sick people, and it's funny. My wife's a doctor too. She's a psychiatrist. That's how I sort of got in this. But my wife is a forensic psychiatrist, less than a clinician these days. Her job is to evaluate people, not so much to treat people. Your job is to treat people. You see sick people, you want to help them feel better. And you don't want to tell them there's nothing I can do for you. There's no hope for your pain. There's no hope for your PTSD. You want to help them. And I totally get that. But if you're an epidemiologist or a researcher who's trying to guide the views and the medical practice of hundreds of thousands of doctors, that's not good enough. So you need to step back. And I think this epidemiologist in Britain who I talked to, he said to me, I try not to draw conclusions because so often when I try to draw them, I'm wrong.
Yeah, and we need to be careful about that, right? And Alex, one thing that was mentioned in your book, was that you often cited the National Academies of Science and Engineering, right? But Ziva Cooper, she's a member of that committee. Sure. I mean, she put out on her Twitter. I mean, you can go to it. It's from January 9th of 2019. She says, in response in the recent New York Times editorial on cannabis, and as a committee member,
which by the way, that came out something that I wrote that came out of the book. No, I'm just trying to give people context of where it came from.
Right, but this is someone you cited.
No,
right?
I didn't cite her. I cited the report.
You cited the report,
yes.
And she's a member of that. Okay.
Yes.
So she said, in response to the recent New York Times editorial on cannabis, as a committee member on NASM, which is that committee, and cannabinoids report, we did not conclude that cannabis causes schizophrenia. Then the Drug Alliance policy also said the report did not reach that conclusion. So, those are pretty two authoritative, sources that are saying that, in your book, you didn't cite the research properly, right? And then also they're saying that you left a lot out, right? They said that they have found an association between marijuana use and improved cognitive outcomes in individuals with psychotic disorders. That's straight from the same report. And, you failed to mention that, right? So I think that, when we're writing books or when we're giving out information, you want to do it from a balanced approach, and you don't want to just select, the small amount of material that's just going to support your study. We want to be truthful here. Joe's show has always been very, very truthful. I mean, Joe said right at the beginning, he doesn't think that that cannabis is perfect for everyone. And I don't think that either. And in Canada, we have really strict guidelines to follow. Basically no one prescribes THC to anyone under the age of 25. And all the conferences and stuff that I go to, we don't really have too many discussions about that. Like the doctors don't really have many much of a backlash about that. So
why is the distinction the age of 25? Why did they decide that age?
So 25 basically is when your brain
lobe.
is fully developed. And when you do look at the studies that do show an association between cannabis and psychosis, it's almost all in adolescence. I think that Alex only has one study in his book that shows an extremely weak correlation between an adult using cannabis and then developing any type of mental illness later. So 25 is a good age, but it's definitely a kind of a conservative ish age, but it's something that we follow, and I think that we've done well with that in Canada.
So Alex, why did you leave those conclusions out of your book?
I need to push back here.
Okay.
So the National Academy of Medicine report was drawn up by a committee of 16 researchers. Ziva Cooper is the one who's publicly said the report said this, but I think that we should have emphasized that it also said this. Okay. What I wrote in that New York Times op-ed, what I wrote in the book, is the plain language of the report. And the plain language is this. Cannabis use is associated with a risk of developing schizophrenia and other psychoses. The higher the use, the greater the risk. I may have a word or two wrong in that because I'm doing it from memory, but that's what it said. And by the way, the committee was very clear. They separated depression. They said we don't see as nearly as high risk for depression as psychosis, even though, by the way, just today, JAMA Psychiatry, the Journal of the American Medical Association Psychiatry, put out a meta-analysis showing that cannabis is associated with depression and suicidal thinking, and actually suicide attempts at a 3.5 to 1 rate. This literally was released today. But to go back, Ziva is one of 16 members of that committee. So if you're going to say that I misquoted the report, which I didn't, I quoted it entirely accurately, you need to say, well, why aren't the other 15 members of that committee saying that I misquoted? Why is one person who works for the Cannabis Research Initiative at UCLA, which takes money from cannabis investors and users, she's the one who said that I misquoted it? Maybe we should ask why the other members of the committee are not speaking out against my book.
Well, I think that she was just one of the 16 members that came out, but you can't really expect all the other members to potentially come out with that as well.
Why not?
Well, some people will.
If I did something wrong, if I misquoted them.
Well, some people will and some people won't. Some people have, the personality. Some people have the platform. Like, Ziva has a bunch of followers on her Twitter. People know who she is. A lot of people who do research actually are not into social media at all. Like, I don't think you were at all before you had your book, were you?
Yeah. I mean, I was a novelist, right? So I was promoting my book.
So you weren't into social media at all. So, I don't think that most people on that committee are into social media. Ziva just happens to be, and I even spoke to Ziva on the phone about this, and and she said that I don't that she agrees with everything that was in the report, but she doesn't agree with your conclusions. And to go back,
my conclusions are quoted from the report.
But you're only quoting the parts that cite that back your opinions. You're not quoting the entire part. Like you left. Like, why did you leave out the part that said they have found an association between marijuana use and improved cognitive outcomes in individuals with psychotic disorders? Right. So you're leaving out that part. So why'd you leave that part out?
You leave out that part.
If you can find me a psychiatrist who thinks that it's a good idea for somebody with an active psychotic disorder to use
why did you leave out that part?
But why'd you leave out that part?
Well, my book presents, it makes a case, right? It makes a case that this is a big issue that we have not heard about at all. And the reasons that we haven't heard about it have a lot to do with the advocacy community and the way they've presented this data for 25 years. I wrote a book that is trying to break through a lot of noise.
So, but still, like, to get a balanced approach, Did you decide that you were only going to write about things that confirm the belief that you held when you were writing this and what you were trying to push in the title of the book and in the conclusion of the book?
I think that's a really great question. I say in the introduction of the book, this book is not balanced.
Okay.
There's not a lot of evidence in there. If you
That's fair.
If you want to read about how indica and sativa strains are different, and you're not going to read that in this book. But I also want to say this. I didn't come at this, and I say this in the introduction of the book too, as an anti-cannabis crusader. In fact, when my wife said to me, as she said to me over and over again in 2014 and 15 and 16, these are the cases that I'm seeing. These are the terrible things that people are doing after cannabis use. I sort of said to her, first of all, why do I always have to hear about this at the dinner table? Mm-hmm. But more importantly, why is it that maybe these people were using other drugs? Maybe you're seeing a slice of the population that's not representative. Why is it that I should believe this? This sounds like reefer madness to me. And ultimately, my wife, who's the one who went to, she actually, as I was talking to Dr. Hart about this, she grew up in Newfoundland too. She went to the Memorial University of Newfoundland Medical School, and she went to Harvard and Columbia for her postgraduate training. Eventually she got tired of me yapping back at her, and she said, why don't you go read the studies yourself? And it was that led me to write this book, because when I read the studies, I could not believe the strength of the evidence, Joe.
But you're still, even in saying that, you're still seeing positive results that you're excluding.
Again, there's this one sentence. I mean, it's not just one sentence, but there are a few sentences about how it may be that cannabis helps people's positive. It helps cognition in people with psychosis. Maybe not.
Wouldn't that qualify as medicine?
Not if it's no. It wouldn't be approved as medicine if it's causing them to have other psychotic episodes.
But if these people have psychotic breaks and it improves cognitive function in people with psychotic breaks,
so
wouldn't that be something that you would prescribe to someone?
No. Again, you need to think about how the FDA is looking at medicine.
No, I understand the FDA's position.
Sure.
But I mean, looking at it as medicine, I mean, if we could prove this through studies and through some sort of clinical trials.
If it is improving your IQ 2 points on a test, and I'm
Is
not
that
saying
all
it
it
is. I'm not. I think we'd have to look it up.
I'd have to look at that. I'm not sure what the exact outcomes are.
But at the same time, it's making you floridly. Right. No, it's true. But at the same time, it's making you floridly psychotic. That's not medicine.
Well, it's not necessarily at the same time. One of the things that I read about schizophrenia was that people were trying to make a correlation between marijuana use and schizophrenia, but the problem with that correlation, in what I read, and maybe you could help me on this, was that it's the exact same number that you find in the general population. It's essentially 1% of the general population has schizophrenia, which is 1 out of 100 people. And when you have marijuana users, you see it's essentially that same number mirrored. And so they're saying in a small number of people.
True, Joe.
Hold on, but let me get. In a small number of people, what they were saying essentially, and what I read, was that marijuana use was associated with the onset of schizophrenia. They were disputing this in this study because they were saying, because the same number is mirrored in the general population. Again, correlation does not equal causation, right?
Dr. Hart, I think you got to tell them that's not true.
So tell me what that means.
So traditionally, yes, when you look up the stats, you'll see that the people who use cannabis versus the people who don't use cannabis have very similar rates. But getting to the exact rates, so in the U.S. they say that the range for schizophrenia is between 0.25 to 0.64%. Globally, they say it's 0.33 to 0.75%. So, right there, it's, apparently lower in the U.S. And the U.S. has the highest percentage of cannabis consumption in the world. And the U.S. also has a lot of people that are using high potency THC. So, I think that, we really need to be careful about throwing out, stats like that, because, when you do look at the stats that we have, it shows that even though, there's a lot of cannabis use in the United States, schizophrenia rates have remained the same.
So I have to push back really hard
Please.
on this. This is one of the great myths of legalization.
Okay.
No one knows what the schizophrenia or psychosis rate is in the U.S.
Right,
okay?
because a lot of people aren't treated.
People aren't treated. People get different diagnoses at different times. Mm-hmm. We have bad health care in this country, and we have a lot of protections around mental health. In fact, in 2017, the National Institutes of Mental Health suddenly changed its estimate for the percentage of people with schizophrenia in the U.S. from 1.1% to 0.3%. They did it with no public notice, and then this researcher said, hey, this is a miracle. They just cured 2 million people with schizophrenia. And then in response to that, the director of the NIMH said, well, we actually don't know how many people have schizophrenia in the United States. Nobody knows. Nobody knows if the rate is increasing. Nobody knows if it's decreasing. The only countries where they can count noses on this with any accuracy are in Northern Europe because they have good health care, because they have slightly less protections around sort of individual privacy and mental health privacy. And so they are able to count cases. And in Denmark and Finland, which are the two places where they've actually done this research in the last 20 years, they've shown increasing rates of schizophrenia between about 1995 and about 2010. And that goes side by side with increasing rates of cannabis use in the 90s. So the people who are saying that there's no evidence of population-wide increases in psychosis are just wrong. But
isn't it possible that there's other factors?
Oh, absolutely.
I mean, environmental factors, there's a bunch of other different things that
let
you
me
could consider.
Be clear on this. We absolutely don't have the evidence at this point to say that cannabis use in the U.S. is causing a population-level increase in psychosis and schizophrenia, which are, by the way, those are sort of different illnesses, and we can talk about that too. So we don't have the evidence to say there's a definite increase. But what I'm saying is that what you have been told, that there is no increase in schizophrenia or psychosis rates in the U.S., we don't know if that's true or not. We just don't know.
Let me ask you this. There has been proven that there's an increase in marijuana use. Is that correct?
Yes,
correct.
Absolutely.
Yes. When did the increase begin, and what percentage is that increase?
So there was an increase in the 90s, an increase in use and in potency. Use sort of bottomed out around 1991, and then there was sort of a flat.
Bottomed out mean it hasn't increased since 91 to
No,
2019?
it's gone up about 50% since 92.
Yeah,
roughly.
no, so
That's a lot.
That's a lot.
Well, wouldn't you expect a corresponding increase in schizophrenia if there was any sort of correlation?
So hold on, let me walk you through. Okay, it bottomed out in the early 90s.
Okay.
Increased again, increased in the 90s, flattened out between about 2000, 2006, and since then has been going up again, especially in, let's say, the last 3-4 years. And the other thing is that potency in the last 15 years has gone way up. I don't think anybody would dispute that.
Right.
Okay.
Has schizophrenia gone up?
So what I'm saying to you is we don't know. There is evidence. There is now evidence on a population level basis in those other countries that schizophrenia and psychosis has gone up. And there's, for the first time in 2017, there's data showing that serious mental illness, which is not the same as psychosis or schizophrenia, in the U.S. doubled between 2008 and 2017 in people aged 18 to 25. And those are the people who are most likely to be using. So for the first time, there's actually evidence of what you're talking about, which is a population-wide increase. Now, again, I'm not going to say...
Can I get you to clarify it?
Sure.
When you say serious mental health,
So serious mental illness, so this was defined... there's a study called the National Survey on Drug Use and Health. It's done every year, covers 70,000 people. Federal government funds it. It's sort of the best data source we have on all this stuff. It showed that, and they're not counting cases either. Let me just be as clear as I can on this. Nobody's counting schizophrenia cases on a national or even state level basis in the U.S. But you say to people, did you have depression so bad that you couldn't get out of bed? Did you, were you hospitalized this year for any inpatient psychiatric reason? And if you look at those numbers, in 2008, 3.7%, I remember maybe it was 3.8% of Americans 18 to 25 reported at least one symptom. So they were categorized as having serious mental illness that year. In 2017, that number was 7.5%. So that's a doubling. So again, I am not going to say that proves that the increase in cannabis use has caused this population level increase. But something bad has happened. And if you look at kids 12 to 17, interestingly, they, over that time period, didn't have a big increase in cannabis use. In general, teenagers are pretty healthy now, although Juul and vaping may be undoing that. And those kids didn't have a population level increase in serious mental illness.
Can I stop you for a second there, because there's other factors.
Oh, sure.
One of the big one is Yuval Noah Harari has a great book, 21 Lessons for the 21st Century.
I read that.
It's great. And one of the things they talk about is the onset of social media. Jonathan Haidt talked about that as well.
Yeah.
And that the onset of social media, well, it was actually more Haidt than Yuval Harari. But the Jonathan Haidt talks about it with young people.
Yeah,
I think it's the coddling of the American mind. Yeah. I think that social media and the pressures of social media have led an incredible amount of young people to serious mental distress and, serious anxiety, serious depression, and suicide amongst young girls has increased some 50%, according to Haidt, over the period of 2007 to, I think, 2000, whenever his book was written. And I think they're directly correlating that to the pressures of social media and to, anonymous online bullying and all these different factors that are affecting kids.
Yeah.
So I think that could be considered a far more significant new form of distress to children and young people than even marijuana.
I think it does it twofold, because I think that, what makes people really depressed, maybe more so than anxious, but definitely both, is that when you compare yourself to someone else. And,
Yes.
People, obviously that we've done that, all humans have done that, since history began. But now everything is online. You can compare your life to everyone, and people are doing it all the time. And even worse than that, and we should talk about this too, is that the income gap is getting wider. So it's like people's lives, not only are they getting better than other people's lives, but now it's on display so everyone can see it. Whereas before, maybe you wouldn't have seen it because it wasn't on social media, but now it's on social media. So you have this huge income gap that just keeps getting bigger and bigger and bigger, and then you have people going on social media and they're comparing themselves. And you're absolutely right, especially in that age population. I mean, people under the age of 30. They're definitely, they're being bullied online. Like I see it every day in my office, like literally every day people are being bullied online. And that's, something that I never had, to deal with growing up.
Yeah.
And, a lot of kids do have to deal with that. Just one more note too on the since Colorado has legalized cannabis. This is important for this subject and this topic. They've actually seen marijuana rates decrease. So it's important for people to know that
No. They haven't.
Yeah,
are you talking
pull
about
up the study.
teen use or overall use? Overall use has gone up. Teen use is flat. Overall use is up.
Okay, yeah, I'm talking about teen use.
Okay,
That's the category that we're talking about, under 30, right? So teen use, would classify as part of that category. So, in Colorado, we have seen a decrease.
Do you think that's because of the lack of, because it's not illegal, it's not as exciting to them?
Part of it for sure, you know, and I mean, part of it, like one worry I had, I haven't looked into the statistics yet, was, when you're growing up and when you're in high school, if you want to be part of the cool crowd, so to say, you usually drink or you smoke pot. That's what people do. I hope that doesn't change because pot's seen as medicine. I hope that people don't move on to or do something harsher because they don't see pot as cool anymore.
Right. There's no stigma attached to it because it's legal.
Yeah. So I got to push back on a couple of things.
Please.
So everything you say about social media it sort of intuitively sounds correct, right? Mm-hmm. The problem is the data doesn't support this at all. The data shows that teenagers, another 12 to 17, those kids are healthier than they were 10 or 20 or 30 years ago. They drink less, they smoke less, they have sex later, they have fewer abortions. They are healthier. Okay. And their mental health doesn't seem to have changed that much based on the NSDUH data, okay? The data shows a big change in kids 18 to 25. They go to college, something goes wrong for a lot of those kids, at least in the last few years. Now,
but wait a minute, when you're talking about suicide rates, suicide rates are, especially with young girls who are apparently more affected by social media. They have gone up significantly since the rise of social media. That is the big factor.
The people who are most
hold on a second, more so than cannabis use, and then that's a fact.
So you're talking about a tiny number. The people who commit,
it's not a tiny number. It's a 50% increase of people that commit suicide that are young girls.
The people who commit suicide in the United States are middle-aged white men. And
Okay,
that's
but
a
young
fact.
girl. But wait a minute, you're discounting these young girls that are committing suicide to fit your statistics or to fit your conclusions.
No, what I'm saying is that's a tiny, tiny number.
But
Joe.
it's a 50% increase. Is not a tiny amount.
This is something we can look up.
Well, let's find out what the
yes.
numbers are,
But
because
so-
like when Jonathan Haidt was on the podcast and he discussed it, I mean, he showed this chart, and it's an alarming increase, directly correlating with the increase in use of social media.
Sure. And by the way, I'm
But
not
why
saying,
would you push back against that?
So-
That seems
so-
to be a factor.
What I'm pushing back against is the idea that kids 12 to 17 generally are less healthy than they were 10 or 20 years ago.
No
The
one's saying
evidence-
they're less healthy.
The-
You just said they're more healthy.
Yeah, I'm saying they're more healthy.
Right,
And I'm
but
also
we're saying
that
mental
kids,
health has nothing to do with cardiovascular
No. I
fitness
mean mentally healthy. I mean they're less likely to use drugs. They're less likely to have sex.
but
I'm
they're
saying-
more likely to commit suicide.
Oh, that is a tiny, tiny number.
What are you talking about? If it's 50% increase, that's a huge difference.
We should look up the number if we're gonna
Well,
actually.
look, Jonathan Haidt's work is like very well respected.
What I'm saying to you is that there's a clear increase in psychological distress in kids and young adults 18 to 25. Okay, there's a clear increase. And those are the people who are most likely to be using cannabis
Those
right
are the
now.
people that are most likely on social media as well.
Sure.
And that's a stressful period of your
I
life,
absolutely
Alex. Like 12 to
understand.
17,
Look,
you're
I'm
usually
willing-
living at home. Like 18 to 25, then you got to go to university. You got to
I'm
deal with all
willing
these
to
courses and
concede.
stuff.
I'm willing to concede that, and I've said at the beginning of the program that I think that marijuana with some people is not beneficial, and in fact could be negative. But I don't understand why you're not willing to admit that social media has a significant and unprecedented impact on young people that we've never seen before.
I would totally agree with that. But I don't think that you can say, based on the population level data, that the impact is all negative. It may be, listen, it may be.
Who's saying that the impact is all negative? What we're saying is a 50% increase in suicide with young girls.
Right, but
that's huge.
Let me give you an example. When you were 15, or I was 15, maybe you got really drunk, right, and wound up in a bathtub. Like, maybe kids today are less likely to do that because of social media, because they know it's going to be on Instagram forever.
I don't think that's true. I don't think that's proven. And
No, it's
I
not.
don't think there's anything that would point to that.
Well, what I can tell you is proven is that kids today, I'm talking about teens, 12 to 17, have less psychological distress by all these measures. I'm talking about their actual behaviors are better or worse. That's a moral judgment, but they're healthier than they were 10 or 20 or 30 years ago. They're less likely to have sex. They're less when they're 14, which I think most people say is a good thing. They're less likely to be drinking. They're less likely to be smoking. Those are good things.
Well, less likely to be drinking, less likely to be smoking, less likely to have sex does not correlate to positive mental outlook and less suicide.
Well, yes, I agree there. Let's look at the numbers. Okay.
But depression and suicide
Well,
are very
depression and-
difficult things to measure, right?
Depression, well, suicide's actually pretty
Suicide's
easy to
very
measure.
easy
It's
to
a
measure. Right.
hard number. Depression is
look at this
more
spike.
complicated.
The bottom number is in females.
So okay, I mean, this is what I'm saying. The death rate. First of all, this is okay. The death rate for girls, age 15 to 19, is 4 per 100,000. Joe.
It's at a 40-year high.
Right. So, I mean, you'd be hard put to say that's a huge spike. It was 3 per 100,000 in 1975, and it's a little bit over 4 in 2015. That's one case per 100,000 girls.
Yeah, I don't know what the actual facts are. I'm looking at this right now. The suicide rates for teens 15 to 19 years old. This is something that we'd have to study.
Sure. And
to have this discussion.
what I'm
Look at
telling
a
you is
giant spike for boys in the 1990s. What
Yeah.
the fuck is that about? 95.
What
An
I'm
enormous
telling you is,
spike.
if you put middle-aged men on this chart, you'd have to blow out the ceiling. Like the suicide crisis is unfortunately a crisis of age.
Okay, I would agree with that. I think we actually talked about that yesterday with Andrew Yang, that suicide amongst men in their 50s, and then they start to feel useless.
Yeah.
And especially if they lose their jobs. But what Jonathan Haidt is pointing to is a direct correlation between social media use, depression, and suicide amongst young girls.
So thank you for finding that. By the way.
What is it?
This is the article it's from. From this.
Suicide rate for teen girls, the highest it's been in 40 years, is social media to blame.
Right. So
And there's-
Okay.
I clicked on that link.
new data released Thursday by the Atlanta-based Centers for Disease Control and Prevention. Suicide rates amongst 15 to 19-year-old girls doubled between 2007 and 2015, reaching a 40-year high. I would say that's significant.
Again, I would, and it's obviously a terrible thing when anybody commits suicide, but
that
we're talking about 2 per 100,000.
I understand. Actually, it's 5.
Well, it went from 2 to 4.
Okay,
Sure.
that means for every 100,000 American girls in 2015, 5 committed suicide. That's not a very high number, but I mean, that's also someone who's pushed to the extreme
Sure.
of taking their life. How many girls are experiencing severe depression but don't commit suicide? That's the real factor, because this is what hate directly connects to social media. Again, the 50% increase, you're talking about a relatively small number because not as many girls commit suicide as men. But still, you were talking about depression.
Right.
And you were talking about these significant factors that would lead
Sure.
people to have poor mental health.
Yeah.
This could be a huge factor in this, right?
And I think that too, it leads people to, suicidal ideations and depression and anxiety. I mean, right here, we're just looking at suicide,
death.
which is, the worst endpoint
sure.
possible,
Absolutely.
right?
Which is very rare amongst girls, period.
Yes, absolutely.
Or less common.
It is, yes. Men do commit suicide more than women do. But, we really have to be, careful about that because, again, suicide is the end. It's the worst thing that could possibly happen. So what about all the things leading up to it? Are there people who don't commit suicide but suffer from terrible depression, suffer from terrible anxiety, suffer from terrible insomnia? Those people are not accounted for in that graph.
I agree. And what I'm saying is that cannabis use has spiked in the United States in the last 15 years. Mm-hmm. And teens notwithstanding, we've seen a large degradation in a number of these social outcomes. And now just today, we have a JAMA Psychiatry paper that looked at a bunch of other studies that said cannabis use in teenagers is associated with depression, suicidal ideation, and suicide attempts in people once they get to 18 to 30. Okay,
but
so
again,
it could
too,
possibly be a factor.
What's that?
It could possibly be a factor.
Sure.
Yes, but it might also be that these kids are depressed because of social media and they're using cannabis.
Or they're depressed because their friends died from opioid overdose. There's a lot of potential.
There's a lot of
I agree.
factors.
I agree.
We are conceding the fact that, you just said again, that study was done on adolescents. Joe and I have both conceded multiple times that, we do not think high THC cannabis is good for people in that age category. But, just to back up just a little bit again, I don't, like I said earlier that, I don't prescribe THC generally to anyone under the age of 25, and most other doctors in Canada don't. But I think that we should be prescribing CBD to these kids. Like a lot of those kids, who have suicidal ideations, depression. I mean, you could never do a study on it, but, how many of those kids wouldn't have committed suicide or wouldn't be feeling this way if they were using CBD? Because we know SSRI, selective serotonin reuptake inhibitors, which are the most commonly prescribed medication for depression and anxiety, even in adolescents. We know that they can increase suicidal ideation. That's been shown. Sure. I mean, it's written right on the package. So again, like as a clinician, you have to treat your patients. If you're just treating people with something that's not effective or that has horrible side effects, you're going to look at other alternative treatments. A lot of people have had excellent results with CBD in that age category. I've had it done in my practice, and lots of other physicians have had it done in their practice. So it's really important that when we're talking about teenagers and when you're talking about that study, you're talking about high potency THC in adolescence. That's where Joe and I both concede that THC is not a good medicine.
Look, if GW Pharma or somebody else can do a study with CBD in depression or some other cannabinoids, a non-intoxicating cannabinoid in depression, and get it approved for that, that'd be great. We need all the treatments for depression and boy, do we need treatments for psychosis that we can get. I totally agree with that. And I'm really glad to hear you say you don't think that adolescents should be using high potency
or any hard drugs.
Or any hard drugs.
Especially alcohol.
No, and they should try to also, stay away from the other medications.
So I want to push back on this, on the alcohol versus cannabis for teens thing. And I know that this is a common feeling among people in Brooklyn and among people in LA and sort of right when I mean right thinking, I mean sort of the general center left to left view everywhere is that cannabis is better for teens than alcohol. I totally disagree with that. Alcohol.
But no one's saying that. I'm just saying alcohol is bad too.
Yeah. Okay, then we agree. But
I think
you have heard this, right? Oh, I'd rather have my kid smoking pot. My 16-year-old. I think that's crazy.
I think you have to really be careful with anything that severely perturbs your sense of reality. When you're a young kid and you're trying to form your vision of the world. I think to unpack what we're saying here is that there is an increase in mental health disorders amongst young kids that corresponds to the increased use of social media and may correspond to the use of cannabis, but that's not necessarily proven. What we guarantee almost universally is these kids are on social media.
And also too,
but I think much more likely that they're on social media than use cannabis. I think a lot of them use cannabis. I don't think all of them do.
That's
I think
true.
all of them are on social media.
Absolutely. Yeah, I think that, almost every single kid these days has a cell phone and they have some type of social media account.
I'm worried about kids using everything. I'm worried about them using Valium. I'm worried about them using Xanax.
They get prescribed benzos all the time. And by the way, the ADD stimulants are
Adderall.
I don't think. Yes, I don't
Prozac.
think. I think psychiatrists give out ADD medicine much too frequently.
I 100% agree, and I think that it has a severe impact on kids when they're trying to study for tests, when they're trying to take their SATs, when they're trying to get into a good college. I know so many people that are on that shit. I know so many people, whether they're journalists, I know comedians, I know a lot of fucking people who are on Adderall.
Yes.
Yeah. And you need to develop that kind of like toughness when you're young. Like you shouldn't just be like, 14 years old and then, you run into your first, bit of trouble in your life and then you reach for a pill. That's terrible, right?
Yes.
That's a terrible coping mechanism. So, when you teach that to kids at an early age and when you tell them, it's such a terrible thing to tell someone, oh, you're 14 years old, you have major depressive disorder, you're going to take this pill, you need it for the rest of your life. Right. And that's said to people all the time. Yeah.
Well,
they say that, oh, you have a biochemical deficiency and this is what you need. We need kids to be tougher, right? So you need them to, build up some resiliency so that, when they do go through hard times, they have better coping mechanisms. Like Joe talks about diet and exercise all the time. Yes. I talk about diet and exercise all the time.
Well, clearly you guys live it.
And that's kind of how I got my start on social media. It is through diet and exercise.
Yeah, I think exercise is a big one for young kids. Yes. I mean, it was a gigantic factor for me personally. When I was 15 years old, I really got into martial arts, and it changed my life. And It changed my life by alleviating so much anxiety, giving me so much more relax. My parents talk about it. They're like, there's two yous. There's you before martial arts, and there's you after martial arts.
But you have relatively young kids, I know.
Yes.
And so do I. And boy, they love the devices. I mean, we have to fight, and our kids. Fortunately, they're 3 and 6 at this point. They don't have their own iPad or iPhone or any of that stuff. But you give it to them for 5 minutes, it's like crack. It's like you got to tear it out of their hands.
Oh yeah, my kid will just turn their shoulder when I try to get the iPad from her. Yeah. They're like, no, one more. Like, it's crazy. It's very fun and exciting for them, And look, it's not entirely negative. Like we have this TV set up with this dance game that they play, and they're sweating and dancing, and after it's over, they're giggling and laughing. It's a massive alleviator of physical stress. Because it's like they're constantly got to follow this thing, and it's an exercise routine. Yeah, I mean their cardiovascular rate gets up, and they really feel good afterwards. So it's not entirely negative, but it's mostly negative.
Yes. Yeah. But if you have like I don't know, is it Nintendo Wii or whatever it is? Yeah, you can do.
Well, it's an Xbox with this little thing that scans it, or you actually can use your phone. And if you hold a phone, like I'll give them my phone, my wife will give the other one her phone, and like the phone shows how you're moving. It's very weird.
Great.
So like you mimic this thing that the person on the screen is doing. But that's one thing that could be considered positive. I think for the most part, the real issue is social pressure and anxiety that comes from kids talking shit about each other, and they push buttons. They push buttons on each other because they know that they can.
But
like,
they don't understand the consequences. Been part of high school, don't you think?
It has, but you would get free from it when you went home. You're not free from it ever now. These kids are waking up in the middle of the night and checking their Twitter account and finding their friends are talking shit about them, whether it's on Facebook or whatever. And this girl from school, that fucking bitch, and she commented on my YouTube video. This is what they're dealing with.
Yeah.
You know, look at her with her fat face, LOL. And then this little 12-year-old's like, oh, that's a severe factor that no one had to consider before.
Yes.
And it makes you almost not want to go to school. Like there's kids who don't go to school because of that, because they don't want to have to deal with, someone said I see it in my office all the time. Someone said something to them last night on social media, so I didn't go to school today, because they don't want to have to face that. Like that's something that, my generation never ever had to face.
But I think we're a little bit off topic here in terms of, so we're talking about depression and anxiety.
Right, but we're talking about a factor that could be considered as big, if not bigger.
But social media does
marijuana.
not cause people to get psychotic. Okay.
I don't know about that. Well, I don't listen. This is why I don't know about that. Severe anxiety, lack of sleep, depression, absolutely are correlated with altercations on social media.
Sure, but
social interactions that are severely negative. They're correlated with poor mental health.
The good news is the brain is a relatively strong and powerful
for some
organ.
People.
But and if you look at sort of worldwide,
it's not for everybody. Some people are in a really bad situation.
If you look at worldwide levels of psychosis, okay, again, it's less than 1% for schizophrenia, which is the most severe version. You add you had bipolar disorder with psychosis, depressive psychosis, other kinds of psychosis. Maybe you get to about 3 to 4% of the population is going to be diagnosed clinically with one of these illnesses over the course of their life. So, okay, on the one hand, that's a lot of people. On the other hand, most people are not going to get psychotic. And most of the time, if they do, there's either a genetic component that's obvious, because psychosis and schizophrenia often do run in families, or there's an environmental component that's pretty obvious. I mean, people can get psychotic. They can get a brain tumor, can make them psychotic. They can, late in life, they can get dementia that makes them psychotic. There's oftentimes a pretty clear organic cause. Okay, so when we're talking, so the brain is a relatively strong and healthy organ, and it takes a lot to break it, and that's why. I mean,
boy, that's a bold statement.
It is a bold statement, but again,
I would not agree with that at all.
You think?
No.
Okay. I mean, I'm not saying that people don't get depressed or
anxious. It takes a lot to break. People are depressed all over the place.
Yes, but I'm talking about the
Do you know that that fucking antipsychotic medication was the #1 prescribed medication in the country?
It's crazy. Like people say to me, that people used to say, "Oh, I'm on antidepressants. I'm on anti-anxiety medication." Now people I hear them at parties and stuff saying like, "Oh, I'm on Seroquel." I'm just thinking that person just tell a bunch of people that they're on antipsychotic.
Right. Well, people don't. Crazy. It's weird that people don't know that Seroquel and Abilify are antipsychotics, right? Because they've been sort of marketed as outside the class when in reality they're part of the class. But I got to push back on you a little bit. Sales numbers for those drugs, those are expensive drugs. They're not the most prescribed drugs in the country.
Hold on. Abilify was the most prescribed drug in the United States.
We should look that up.
We have looked that up. We've talked about it on the podcast because it's insane.
That is insane.
And we do know too, this is a good time too to talk a little bit about genetics after we kind of look at this.
Yes, let's look at this.
Because we can tease out a few things by looking at genetics.
The antipsychotic Abilify is the biggest selling prescription drug in the U.S. To be a top seller, drug has to be expensive and also widely used. Abilify is both. It's the 14th most prescribed brand name medication.
So it's 14th.
But fucking that's crazy.
Right, I agree.
Out of all the people with actual diseases, this is the 14th most prescribed brand name medication that retails for about $30 a pill.
Well, Dr. Hart can probably tell you, this is getting prescribed as an add-on antidepressant for some people.
What that means though too is that people are struggling, man.
Yes.
Like life is hard for a lot of people.
Yes.
Like very hard, Alex.
I
very
agree.
difficult. Okay. So a lot of people need something sometimes at the end of the day or during the day to help them get through the day. Cannabis, especially the CBD component and also the THC component when used properly is okay. Like I tell people all the time, I've made social media posts about it that if you need to use a little bit of cannabis at the end of the day just to help you sleep, man, you're doing great and you're staying away from drugs and prostitution, gambling, all these other brutal habits that people have.
Cut them some slack.
If you're doing all that, then you're doing pretty good overall, right?
Some gambling's not bad, bro.
A little bit of gambling. Sometimes
you
I bet on UFC fights.
You want to bet on some fights, you know what's
Absolutely. By the way, I think giving people handheld devices that that are inherently addictive, where they can bet on sports every 15 seconds, is a
Yes.
super bad idea.
I
But we
100% agree.
can talk about that too.
Look, man, you know what's one thing that's benefited me with social media is my eyesight is going. As I've gotten older, I can't even read my Twitter feed. Fuck these people. I don't read it. If I don't put my glasses on, I don't know what the fuck they're saying.
Oh my
So
god,
it's
so good.
excellent.
But I'm not saying people don't get depressed and get anxious. I'm saying psychosis is a different thing.
Yes. Okay.
And
I think we are though discussing overall mental health.
Yes.
I mean, look, I'm saying this because I really think that this is something that I've made a big turn over the last few years with myself. That I don't
take a quick
think.
bathroom break.
Yeah,
That's
please
okay.
go. I don't think marijuana is as safe as I used to think it is. I used to think it was benign. I really used to think there was no big deal. But I have a friend that I discussed the other day who is a really confident, fucking muscular, handsome man that never did anything. And he took a marijuana edible to go to sleep. And for 2 weeks, this guy was this is a different guy, not the guy I was talking
it's
about.
not the guy.
Rafi. No, a different guy. He took it and he experienced suicidal thoughts and all these. He had like severe consequences. I think that the human beings, we vary so much biologically that to just make this overall blanket statement, what's good for you is good for me, is irresponsible. And I've been irresponsible saying that before.
Well, one reason, it's interesting, one reason I think that alcohol is so widely accepted, despite all the problems it causes, and again, alcohol can certainly cause problems, is that alcohol affects most people pretty much the same way. You know, and you sort of know what somebody looks like when they have one drink, when they have 5 drinks, if they have 10 drinks.
I've got some friends that get those gerbil eyes. You ever see when people get shark eyes? They're just gone, and then they start talking crazy and like, whoa.
But no, but you sort of know that, and you sort of know how long it's going to take to clear your body. And cannabis is so different. It's a really complicated drug, and it does affect different people in different ways.
Yes, and also the tolerance has changed radically.
Yeah, so you know, people say, well, 2.5 milligrams of THC, you vape it, that's like one drink for somebody who doesn't use. But then if you're a tolerant user, you can use 200 milligrams in a day. That's 80 drinks.
Yes.
It's a weird drug.
And then there's the issue of eating it.
Yes.
When you eat it, your body produces something called 11-hydroxy metabolite. It's far more psychoactive.
Yeah, you were all along for the ride when that happens.
Yes, you are. Yes, and it can take days for it to get out of your system. I know many people have eaten marijuana edibles, and then they call me up the next day like, dude, I'm still high.
Yeah.
Yeah, it's
so,
real.
So I think the legalization community has sort of said for years, like, oh, there's basically no downsides to this. There's only upsides. The cops will bust smokers. There'll be tax revenue. All these people have a way to get high that's clearly safer than alcohol. And unfortunately, that's just not true.
I think you're right, and I think the issue that people, from what I've read, are having with your book are people that are marijuana advocates that think that your position is unbalanced and that you've ignored the positive aspects of THC in terms of like what he was talking about, cognitive benefits for people with psychotic episodes, and that you are only focusing on the negative.
I guess I will plead guilty to that.
Yeah.
Because I think that for 20 years, people have only heard the positives.
Right. I think that's also, I'll plead guilty to that myself because I think that I've only been discussing the positives. And one of the things that I've tried very hard to do, and one of the things I've learned how to do from doing this podcast and experiencing criticism and communicating with a bunch of different people with a lot of different viewpoints, is examine my own positions and try to figure out, am I coming at this from a truly balanced position, or am I trying to support a conclusion that I started out with and I'm trying to, somehow or another back up my own work or back up my own statements and sort of prop them up instead of being really honest and objective.
Right.
And it's very difficult to do.
Listen, I wrote a book called Tell Your Children, The Truth About Marijuana, Mental Illness, and Violence. I don't think you can think that book is going to be a compendium of the pros and cons of marijuana.
Well, if you want to tell your children the truth, though, you really do want to tell them the pros and cons.
Right.
And you did indicate, Alex, you said, we should tell people the truth in the book, right? So, I think that when you're telling, and you're saying that you're telling the truth, and Alex, I'm agreeing with you that you're telling part of the truth.
Right.
But part of the truth is, a little bit deceiving and deceptive in some ways, right? You want to tell the whole truth. When you tell the whole truth, then you give the whole story, and then people can actually make, a good informed decision based upon that. Like if people are going to just read one part of the story, then of course they're going to make a decision just based upon that one part. They're not going to make, an informed decision based upon all of the parts. And because of that, people are going to make, some very poor choices.
I completely agree with that. But to me, the last 20 years have been an exercise in the other side, in the legalization side, doing a very, very good job talking up its arguments. And essentially, there's almost nobody on the other side. There's this one guy, Kevin Sabet, who's gotten killed.
What about Jeff Sessions?
But
you had the fucking goddamn attorney general who's telling people that good people don't smoke marijuana.
And that's literally a quote that he said.
And thank God that little moron's not in office anymore. But that's a terrible thing to say.
Sure,
good people don't smoke marijuana. There's a lot of wonderful people who smoke marijuana.
I agree.
That's just not true.
And by the way, I think this is a personal choice, okay? Especially for adults.
Yes.
Okay. And you can make bad personal choices. You go, look, I play cards. I love to play poker. I'm sad that on this trip to LA, I didn't get to go to a poker room. But you can go into a casino and you can see people who've lost.
Change your flight.
A
lot of places close by. I'll direct you to them. My friend Ari, he used to make a living doing that when he was struggling with comedy.
Don't encourage me. But you can go to a casino and see people who've lost their houses.
Yes,
it doesn't mean that gambling should be illegal.
I agree.
It also means that there's less and more dangerous forms. That device in your hand where you can bet on what the next pitch is going to be, if it's going to be a ball or strike, that's more dangerous than my having to drive to the Commerce and play there. And 100% or 98% THC that an 18-year-old vapes is a lot more dangerous than a 5% CBD, 15% THC product that Dr. Hart might suggest his patient uses once a night to go to sleep.
Agreed.
But that's the message that we should be putting out there, right? We shouldn't just be focusing on one side of the story. Like that part should also be included in the book. And like your book in some ways has made me rethink the way that I write, because my first book was co-authored with Jeremy Costin called Friendly Fire. My second book that I'm writing now is called Cannabis for PTG. So it's how to transform post-traumatic stress into post-traumatic growth, right? Because I feel that, and we all know examples of people that have encountered really difficult obstacles in their life, and some people have succumbed to that stress and they've gone down the wrong path kind of thing, and then other people have used that stress to their advantage and they've actually become better because of it. And CBD and THC can both help facilitate that process. When you're looking at someone like a veteran, for example, the hallmark of someone who has PTSD is someone who doesn't leave their home and they can't sleep at night. So like when I see a vet in my office, a lot of the times they'll be leaving their home like 5 to 10 days a month, right? So when you give them CBD, and this is really important for people to understand, CBD has been shown to decrease learned fear. That's incredible, right? So if you can get people outside of their home, because I'm not talking about, again, someone who's, too nervous to like go to the bar with like their friends or something like that. I'm talking to people who like, it's difficult for them to go to the grocery store, just like pick up a few things. So those are the type of people that I see in my practice. So CBD is really excellent for that. Then when you look at, the nighttime component, THC, again, is excellent for reducing nightmares. That's been shown in studies. And it was even shown with one pharmaceutical drug, Nabilone. Again, I don't really use Nabilone very much because it's only one cannabinoid. And I do believe in the entourage effect and using all of the cannabinoids. So I don't use that much. But that shows that THC can reduce nightmares. And, if you have PTSD, I mean, if you talk to someone who has PTSD, and again, this comes from a clinician's point of view, they will tell you, I will try anything. Right. And that's the same way when you get with like, the parents of kids who have seizures all day. Nobody wants to see that. And like Alex, if your kids, ever started getting seizures, which I hope they don't, because it's terrible, what it can do to people. But when if that ever happened, I would hope that you would consider CBD as a potential treatment option.
I think he's not against that. I think we have to be really clear of this distinction. Like CBD, you're not against CBD at all, and I don't think anybody is. I think no one really is arguing, except maybe the federal government in certain levels is arguing against CBD. That's probably some pushback from the pharmaceutical industry. The reality is CBD is proven to to be, at least as far as I've read, very safe and very effective for a bunch of different disorders, especially those that are about reducing and have something to do with inflammation.
Or seizures.
Yeah,
yes.
one of my good friends, his son has developed seizures, and CBD knocked it out, just killed it entirely.
Let me ask you.
This is very recently.
You know, you're somebody who's a cannabis user. You obviously know a lot of users. Why do you think it is that people, in legal states where they can really express a preference, they can go into a dispensary, know exactly what they're buying? Why is it that they want such high potency THC product?
Because they get used to it. Your tolerance develops. It builds up. Every year we do this thing called Sober October, where we don't do no drinking, no pot, and we do some sort of crazy challenge. Me and 3 of my buddies, and when we do it, it's very interesting how your tolerance is radically reduced. Like I'll smoke pot at the end of that month, and I'm like, holy shit! Like I don't even know what I'm talking about in the mid sentence, and I'm just blitzkrieged. Whereas now, like I smoked a little weed last night, did some stand up, had a great old time. There was no issues with it at all. But I'm used to it. And if the weed that I smoked last night, I assume you don't smoke marijuana.
I do not.
Okay, if you and me were together last night and I gave you a hit of my joint, you'd be still there in the corner in the fetal position going, what in the fuck is going on? Because the marijuana is ridiculously powerful, but once you're accustomed to it, once your body acclimates, it's really not that big of a deal. The problem is you're dealing with a lot of habitual daily users, and for those people, like my friend Joey Diaz, there's a video of him giving this other comedian how many milligrams of those stars of death?
To Lee.
When we give Owen, what did he give Owen?
Oh, I think just one.
He ruined his life.
It would have been about 200 to 250
Yeah.
milligrams.
Yeah, I think I heard that
The guy
podcast. You're saying like
opened
250.
the door and went out. Joey made a video, but the day it changed Owen's life. Like literally fucked the guy's head up. Like he went outside and he vanished. He's gone. It's just-
That's cannabis psychosis.
yeah, well, I think there's a real argument to be made. It's particularly with him.
Well,
But-
I was going to make two points on that. So you definitely can develop a tolerance,
Yeah.
And I tell people all the time, try and take at least 1 3-week break. But the evidence does show that if you stop for 4 weeks, generally all your receptors return, and it'll be like you've never used cannabis before.
Yeah,
so
that's
everyone
my
should show
experience.
it. And that's even with people who are really, really heavy users. I can go back and get the study, but I mean, these people are using, I'm pretty sure it was like close to like 7 joints a day.
Well,
so really heavy users. And
Snoop Dogg's a good example of that. My friend Tony Hinchcliffe is good buddies with Snoop Dogg, and he said Snoop Dogg just smokes all day. And he just like is always high. And you're like, well, what do you do when you're not high? He's like, what? He's like, I'm never not high. So everything he does, he is high as fuck.
Right.
Literally everything he does. Like for that guy, it's not that big of a deal. And for the way he lives his life, like he's just a relaxed, easygoing guy. It's no problem. You can be high all day and live his life. And he's obviously wildly successful with this strategy.
yeah, wildly successful. And the second point I was gonna make on that too, though, was there does not appear to be any tolerance at the CB2 receptor. So THC attaches to the CB1 receptor, and that's where we know we can get tolerance. Some people, they have some pain, they use some THC, and sometimes they need a little bit more. Sometimes asleep, they'll use THC, it'll work, and then it'll stop working. With CBD2, we haven't seen that. Meaning, like the people who get seizure control, generally they don't need to increase the dose. Like the girl I was talking about earlier, I first described her, I think when she was 20, when she was about 20, she's 25 now. She's never increased her dose. She's just used the same amount of CBD for the last 5 years.
That's a medicine, right? Like it works for you.
I think we should really stop talking about CBD.
I just wanted to make a note on the tolerance of the CB1. I just wanted to make a note that CB2, there doesn't appear to be tolerance at all.
Yeah.
Right. Yeah.
It's just there's just such a significant impact when it comes to especially edible THC. There's a significant impact on people's state of mind, and it's not always good.
No,
that's just a fact.
We were talking about this when you were out, but it's funny. I had an interview. I was that guy. I was doing the radio interview on the Acela from DC to New York last month, and this woman came in and it was Baltimore. She sat down next to me. And I finished the interview, and she said I couldn't help overhearing. I thought, oh Jesus, like she's a pothead, or she's just annoyed that I was doing this. no, she said, I was in Seattle last month. This woman was in her early 30s. She was a lawyer, married. She said, and a friend of mine said to me, let's do an edible. She said, we bought a small dose. We asked them for a small dose. I took half of it. So I think she took like 5 milligrams, if that. And she said, I got so paranoid. She said, I couldn't sleep all night. Fortunately, my friend took and didn't have any problem and sort of watched over me. But she said the worst part was it took me weeks for the anxiety to fade.
Yeah.
And I said, do you have a history of mental health problems? And she said, no, I don't. She said, and I'd smoked in college, but this was just a totally different experience for her.
I think there's a big problem with education. A big problem with the education that edible marijuana, as we talked about before, I think you were in the bathroom, the 11-hydroxy metabolite, as it's processed by the liver, it's a radically different drug. Radically different. And it's really a psychedelic. And for me personally, edible marijuana and flotation tanks, I might as well be taking a fucking bucket of acid because it is a crazy goddamn experience. Now, I personally enjoy being paranoid, and I know this sounds crazy, but I think with me, it gives me, and I think I live a pretty blessed life, and I like the feeling of paranoia because it allows me to explore maybe some area, like maybe I'm too confident. Is it a
specific paranoia that you have?
It's a freak out, man. I think I have maybe an abundance of confidence. Maybe I have too much, right? Maybe I'm too successful. What I like about the paranoia that comes with edible marijuana is it allows me to check myself. It allows me to examine all of my behavior in the darkest recesses of my mind, my thoughts, and gives me a perspective, and it makes me a nicer person.
It might knock down the ego just a little tiny bit.
You're
just like the other psychedelics. Sure. I think it gives you just a little. It knocks down the ego just a little. I mean, some people use it, and like at the end of the day, and then like Joe said, I think it makes you reflect sometimes better and more objectively.
Yes.
Meaning that, maybe you had an encounter with someone earlier in the day, and then, late at night, you toke up a bit, and you're like, oh man, I probably should have done things that a little bit different.
Exactly.
That happens to people all the time. It forces you to reflect in a different state. And sometimes when you reflect in that state, you come up with thoughts that you just wouldn't have come up with before.
Yes.
And my patients say to me all the time, it just kind of breaks this negative state that I have. I'm just able to break out of a negative state and think logically. People say that to me all the time.
But see, to me, you're talking about something different, and it works for you, right? Your paranoia it sounds more almost existential. It's how can I be a better person? What am I doing wrong in my life? It's not my wife is poisoning me, or no joke. This is
funny.
When you're schizophrenic and you
I understand.
Or the cops are going to bust through the fucking door and shoot me.
Yes.
Okay,
no,
that's
right.
a different thing, and that's why
that's a different kind of paranoia.
That's why marijuana drives this extreme violence in some people.
Or those people need to get their fucking shit together. That's possible too.
Well, I mean. Listen.
They may need
the aliens aren't really coming, bro.
but they may need to be intervened before.
Yes.
And to Joe's point, though, they have shown in studies that if you make an intervention outside of the psychotic symptoms, you can actually reduce the incidence of violence.
Yes.
And also, too, I think it's a good point I was going to mention earlier to bring up genetics, because we are teasing out genetics for people, and we are discovering that certain people do have certain genetics that do predispose them to certain cannabis disorders, right? So, I'm involved with a company that's doing that right now. We're trying to create cannabis genetic tests for people, right? And there's 3 genes that we've identified so far. One of them is the MAPK14 genotype, and that has been shown to be associated with a deficit in brain volume when you do use cannabis. And then there's 2 other genes, the AKT1 and the CADM2 genotype. Both of those have also been shown to be associated with cannabis. But again, how many people have them? The MAPK14 is roughly about 8% is what we're seeing. The AKT1 is around 4%. And the CADM2 is around 5%. So
But that's
There's
you
so
add
many-
that up. That's
but-
almost 20% of the population.
But we're seeing. But if we can identify, I love that stuff, Lion's Mane.
Yeah, that's great.
Yeah, it's wicked. So if we can identify, the people who are at risk, then we can maybe potentially, use the medicine in a way where only the people who don't have these genetics are using the medicine. And then, for the people who do have these genetics, they stick mostly to CBD. I just think, that's a better approach than, just kind of prohibiting cannabis or saying that, we shouldn't use it at all, or saying that it's not medicine. I think that it should be held to the same standard as any other medicine. And I think that if we had an incredible medicine that worked for some people and that didn't work for others, then what we would do is we would try to figure out why. And, I've been doing that. My company's been doing that. It's called Anant Life. Full disclosure, I am on the board, anantlife.com. And, and when we use these different strategies, then we can actually reduce the overall harm. And that should be another thing that we can add into the mix, because for sure there's people who are definitely more predisposed to mental illness and definitely more predisposed to psychosis.
There do seem to be some people who just it breaks really fast, and I'm not sure why. I mean, again, it's probably genetic.
I think it most likely
but
is.
it's funny. You mentioned. Your friend whose child has autism, and you said, well, if that were my child, of course I would want to do anything possible. But I have to tell you, in the last month since the book came out, I've heard the other side of this. Okay, I've heard from so many parents whose children, and in many cases, high-functioning children, college graduates, because, by the way, those are the people who, who've read the book or heard about the book and who have the resources to stay involved with their kids when they have these terrible breaks, who've gone completely off the rails. And the worst story that I've heard so far came from a woman in Connecticut whose son graduated from Haverford. It's a college in the East. And, sounds like a really good guy. He wanted to teach disadvantaged kids. He had a girlfriend who was going to med, or was a pre-med trying to go to med school. They moved to New Mexico, and for some reason the guy decided to start smoking. This was 2012, and within a few months he'd lost everything. Okay, the girlfriend had left. He'd lost his job. He had his first inpatient hospitalization. Now this is a family with money. Okay, this is Connecticut, suburban, and they have spent the last 6 years trying to save their son, and they have failed. She told me that they've spent more than $500,000. He was hospitalized at Harvard. He had the best treatment. None of it's made a difference to him.
And what are the symptoms? Like, what happened?
So he's completely schizophrenic now, and he's completely paranoid, and he believes. And this is the. So his girlfriend is long gone. But
has he tried CBD?
That's a good question. I think he's continued to use cannabis. I don't know if he's used CBD. But let me just tell you where he is now, okay? So he's one of these guys who has a really bad delusion. His delusion is that his girlfriend has died and been replaced by a robot. So that's the kind of delusion that leads you to kill people. And so this guy's been now hospitalized 17 times. He's gone. He's on the streets of Houston. She doesn't know where he is. And I'll tell you, you read Beautiful Boy, you see the movie, and you think, well, the worst.
I'm not familiar.
Beautiful Boy is about
A Beautiful Mind, isn't it?
No. Beautiful Boy is a book that came out, I think, a couple years ago and got turned into a movie. You should have him on. Nick Sheff and David Sheff, father and son, and the son became a meth addict and essentially almost died. He started smoking cannabis when he was 12, and within a couple of years, it had all gone completely downhill for him. I'm surprised. It's a pretty popular book. But anyway,
have you heard of it?
No.
Jamie?
And I've heard the movie. Yeah.
Yeah.
So you think, well, okay, the worst thing that can happen to you as a parent, the worst thing is your child becomes an opioid addict, and you wait for the call that he overdosed and died. It turns out that that's the second worst thing. That the worst thing that can happen is your son, the college graduate, the want-to-be do-gooder, becomes a schizophrenic living on the streets, and then you're waiting for the call that he killed himself or he killed somebody else. And so my view of this is, in a couple more years, probably, I mean, this book has taken over my life, obviously, but in a couple years, I'm going to be back to writing novels. I'm going to be, this will still be part of my life. But this woman, these parents, they are going to spend their lives trying to destroy the cannabis industry, and that is real.
Well, I think that would be a foolish thing to do, but I think there is a real possibility that some people who have a tendency to schizophrenia could be triggered by cannabis. I don't think
There's
there's
no
any
question
denying.
about that.
But I think it's also possible that guy would have gotten schizophrenia anyway.
Look, it's possible, but he was sort of at the outer edge of the window, and he had no
Out of the other edge of the window.
Meaning,
and
it's
what?
usually for boys, it's sort of 17 to 23, 24.
Was he showing any issues before at all?
No,
Nothing.
according to her. I mean, this is from her, so
Right,
she's the mother.
right.
But
well, I'm sure she'd be the one who knows the most.
There are people, though, too, who just kind of have a decline with or without cannabis.
Yes.
You do hear of people
Sometimes
with
people,
schizophrenia.
it's just a breakup.
Yeah, it's just
Yeah.
they just
Yeah, it's
can't
called the
handle life.
prodrome. Yes.
Yeah.
You know, I mean, I know people, you know, that have gone to medical and stuff, have gone to medical school, and then one semester they just can't handle the course load, and then their life just goes to shit.
Yep.
They
Yeah.
drop out of school.
Yep.
No
Yeah.
one ever hears from them again.
Yep.
They don't get back into school. That's it. Like
Yep.
that does happen
Yep.
all the time.
That speaks
without
to
cannabis.
the fragility of the human mind.
Yeah.
That, that
Well, this
we
is
were
a
talking about
terrible
earlier.
disease. It's
Yes,
a terrible
it
disease
is.
to have.
It is. And it affects a certain percentage of the population regardless of cannabis use. There's a lot of people out there that have schizophrenia that have never used cannabis ever, and they've gone completely, off the edge. I don't know if you can necessarily blame cannabis for that. And it would be really interesting to find out if there was some form of a treatment, like you were saying with CBD, that could counteract that.
So
do that. But
CBD has been shown in early stage studies to have some moderate impact on psychosis. I don't think from the numbers that I've seen suggest it really isn't that strong as an antipsychotic. But I do think that if I were a researcher in schizophrenia, I would be looking at the endocannabinoid system.
Again, yeah, you have to look at this again. I look at it, from a clinical perspective. Like the antipsychotics that we have out there are not good.
They have terrible
right?
side effects,
They have
yeah.
terrible side effects, and most of them do have some initial benefit, but after 2 to 3 years, there's almost no benefit, right? And they have, as you said, really bad side effects, weight gain, metabolic disturbances. Like people want to get off of them. So
Yes.
if you have something like CBD that doesn't have any of those side effects, of course, as a clinician, you're going to want to try it, right? Because you know that the other tools that you have are not really that effective,
Yes.
right? So CBD should definitely be utilized for people who have psychosis and schizophrenia.
Well, I think, we talked about life changes, like things that happen badly in your life, losing your job, losing your girlfriend, deaths in the family can trigger these breaks with some folks, but psychedelic drugs can as well. I mean, it's a fact.
Yes.
For some people, psychedelic drugs have tremendous benefits for PTSD, quitting alcohol, quitting hard drugs. There's a lot of people that have used mushrooms, MDMA for PTSD is a huge thing that MAPS is studying right now.
Yep.
But you can't deny that there's other people, well documented, that have taken LSD, that have taken psilocybin, and then taken them in large doses and gone and never recovered.
Yeah, and that's why too. I forget who it was. Maybe it was McKenna who was on, and you guys were saying that we need to use psychedelic medicines, but we need to use them properly, right?
Yeah.
And that's the same way with cannabis as well. And,
I consider cannabis a psychedelic, particularly when you eat it.
Absolutely, it is a mild psychedelic, and so there's risks and benefits to that, and we need to tease out the risks and tease out the benefits and make sure that people are. But Alex, we need to make sure that people are informed and they get the entire picture, right? So does your book have some truth in it? Yes, of course it does. But does it tell the whole truth? Absolutely not, right? And that's the message that, I think people should be hearing. People shouldn't be hearing just part of the truth. They should be hearing the whole truth. And again, like in your book, like you compared, the Mexico and India, right? And, I talked to German Lopez on the phone about this, and, who talked to Isaac Campos, right? And he said that,
folks?
so Isaac Campos, he's the guy who basically, told the story of how in Mexico, people were blaming marijuana. People were blaming marijuana on causing psychosis during kind of like the early 1900s. And then there was some evidence as well in India at that time. So Alex kind of made the connection, 9,000 miles apart, they're both saying the same thing. But, he said that, you did misinterpret the evidence on it, right? And German told me that on the phone. And I mean, all the cannabis that was used in Mexico at that time was in, really marginalized environments. And then when you look at the India study, and I know that you addressed this in your book, Alex, because I did read your book.
It sounds like you did.
I bought your book, so in some ways I did support you. So I read your book, and like I said, you did address in the part on India that some of the report was wrong, but I mean the fact is that almost a lot of those cases in India were actually attributed to alcohol or opiates or other things, and then the other thing in Mexico is that it was in those environments. So, basically what I'm kind of getting at here is the National Academy of Sciences and Engineering, they disagree with how you interpreted their findings. And then
no, they didn't.
These people
Ziva
disagree with how you interpreted their findings. Okay, but Ziva is only one of the 16 members. Right. I get that. But if we asked other members, I think that they would all say the same thing. Because, Alex, wouldn't you be upset if someone just quoted one part of your book and then left out all the other parts? I mean, honestly, I would think that would be a huge disservice to my work. I would not have put in a ton of effort into something, and then for someone to only have just to pick out the part that
Well, that really depends on whether or not it ignores nuance.
Honestly, if I had written the NASEM report, the NAM report, and came out in 2017 and nobody had paid any attention to it, which nobody did, and nobody did for 2 years, and suddenly people were paying attention to it, I'd be pretty happy about that. But what Dr. Hart is talking about is in the first chapter of the book, which I guess you haven't read, and I really should have a copy for you. Stupid of me.
I got a copy in my bag.
So it's probably
marked up though.
But so this is fascinating to me. The British, they colonized India, and they set up what they called lunatic asylums, really psychiatric hospitals, sort of very primitive psychiatric hospitals. And they were really initially for soldiers in the Indian Army, and they were run by British doctors. And what these doctors really as early as like the late 1850s, 1860s noticed was that a lot of the people who showed up in these hospitals were showing up with what they called ganja, actually. In India it's called ganja, or bhang, which is a very weak preparation of basically Indian hemp, just sort of low-grade cannabis. And so they started counting, and they realized that 20 to 30% of the people who were coming to asylums were heavy cannabis users. And that was way more than alcohol. It was more than opium. And this really fascinating doctor named George Francis William Ewins wrote a book in 1908, and he looked at the evidence. And it is amazing to hear how he describes schizophrenia, how he describes cannabis, how he describes the cases of violence around cannabis. It's like any psychiatrist today, certainly any forensic psychiatrist like my wife, would like everything in the book would ring completely true. And it was so fascinating to me to stumble on this and realize this is something people have been talking about for more than 100 years.
So could we agree that there are some people where cannabis is not a good idea?
Absolutely.
Yeah.
Oh, yeah.
Right. We could agree that.
Yes.
I think we all agree. We also agree that some people can't eat peanuts. Right?
Absolutely.
Yeah.
Yeah.
Right? And
Yeah, it's not the same thing, though.
well, but yeah, you know why? Peanuts kill you.
That's true.
Yeah, it's more dangerous.
Yeah.
So
I think
if
it's like
you have-
7,600 a year.
Yeah.
People die from peanuts.
So-
Again, I think more people die from cannabis as a result of the
that's
homicide
ridiculous.
and the suicide.
Okay, well, there's no correlation that you can
there's no
prove on
stats
paper that
I know. Somebody's got to do the work.
Wait a minute, but why are you saying that then?
Because I've looked at enough data to tell me,
You think marijuana is causing homicides?
oh, yeah, this is what the book is about.
But in how so? In what way?
Because it causes paranoia and psychosis in people. And paranoia and psychosis are huge risks for homicide. And schizophrenia is a
But
huge
there's
risk for
multiple
homicide.
studies that refute that. Like there's multiple
There
studies.
are no studies that refute that paranoia and psychosis are huge risks for homicide. Schizophrenia is a 20x, 20
Okay.
times, Joe.
Well, Jamie, I sent you a document yesterday. I mean, there's multiple studies that show that marijuana laws are not associated with any type of violence.
Okay, so,
Okay, but
so we're
let's
talking
forget
about a
about
different
marijuana
yes,
laws.
That's
Let's
right.
just talk about
the
marijuana
use of the
use.
drug. Yes.
So the use of the drug, which could possibly trigger psychosis and schizophrenia, which are correlated with murder. Is that what you're saying?
They're not correlated. They're triggers. That's
Triggers.
an absolute fact. Yes.
Triggers.
Because
because of the paranoia and delusions, and you think that someone's out to get you, and they're not.
absolutely. I mean,
What are the numbers?
Okay, so the numbers are if you have a diagnosis of schizophrenia, you are 20 times as likely to commit homicide as somebody who's healthy. Now, it's actually worse than that for cannabis, okay? And here's why. So the National Alliance for Mental Illness and the mental illness advocacy groups hate talking about this. Why do they hate talking about it? Obviously because it stigmatizes people with mental illness. So what they say, and this is true, is if you have a diagnosis but you're taking your antipsychotics, even though the side effects might be unpleasant, you're in treatment, you're not using recreational drugs, your risk for violence isn't that high. It's not that much higher than a healthy person, okay? And, fortunately, healthy people don't commit murder that often. The problem is if you think about the math for half a second, if there's this one group of people who don't have a very high risk for murder or serious violence, who, because they're not using, because they're on antipsychotics, it means that the excess risk in the people who are using and whose psychosis is untreated, it must be spectacularly high. And the numbers bear that out. So there's a really good study from last year, 2018, a small group of patients in Switzerland. Now, Switzerland is a safe country, has a low base crime rate, but 50% of the people who were using cannabis and had psychosis over a 3-year period committed violence in that group of people. That's mostly 20-something men.
Well, there's a study here, and I just sent it to you, Jamie, and it's titled "Risk Factors for Violence in Psychosis: A Systemic Review and Meta-Analysis of 110 Studies." So, it's quite a few studies. Okay, so let me just read part of it out to you. So, violence was strongly associated with a history of polysubstance abuse, strongly associated with diagnosis of comorbid substance use disorder and recent substance misuse, and moderately associated with a history of alcohol misuse, a history of substance misuse, recent alcohol misuse, recent drug misuse, and a history of drug misuse. It was unclear if there was an association between violence and a history of cannabis misuse. So again, this is 110 studies. They very carefully looked at all of the different risk factors as to what could trigger violence. Just let me finish, Alex. And what they said, again, it was unclear if there was an association between violence and a history of cannabis misuse, right? So that's 110 studies.
So cannabis use in there is going to get locked in with polysubstance use, because a lot of people who use are going to be using other drugs.
Polysubstance means multiple substances,
right.
Alcohol, cannabis.
Exactly.
But everything else was found to have significant statistical significance.
And I do not know the study that Dr. Hart is talking about. I'd like to look at it. Without looking at it, I can't push back as hard as I would like. What I can tell you is that I have many studies in the book that show that cannabis use is associated with violence in people with psychosis. Okay. And more broadly, it's associated with violence in the general population in large studies, in studies of high school students and bullying, in studies of people who were vacationing in Ibiza, in studies of young men in China and the UK. There are big studies out there that show cannabis use is associated with violence.
Ibiza.
I've been to Ibiza twice.
I know. Wouldn't you like to be the guy doing it?
Are you supposed to say Ibiza? Are you supposed to say it
You
that
are
way?
supposed to say Ibiza.
Yeah.
I got grilled over there for that.
Yeah, they get mad at you.
Yeah.
You're supposed to.
I can't believe I just said it.
Yeah, some dignitary or royal person had a lisp, right? Isn't that how it all started?
Is that true?
Yeah, yeah, I believe so.
Noted.
Yeah, the way the people in Spain pronounce words was directly affected by this one person, apparently. But so this correlation between people that have schizophrenia and using cannabis. How do you is schizophrenia a diagnosis that's purely based on behavior?
Basically, yes.
Yeah.
It's a clinic. There's no blood test.
Right.
You can't do a brain scan. It's basically how you behave and what you tell the doctor about how you're feeling.
Right.
And
And what
that's
about
very subjective.
fMRIs? Or it's very subjective. How so?
So
Because you're asking someone basically a series of questions. I mean, it's no different than depression, really. I mean, you're just asking someone a series of questions, and then, based upon that, which is very subjective, then you're going to make, a clinical decision. Whereas when it's like a blood test, like if someone, passes, a certain amount of hemoglobin A1C, depending on which chart you're looking at, then you're going to call that person pre-diabetic or diabetic. But, unfortunately, we just don't have those objective measurements. And again, that's why, Alex was saying earlier that, they couldn't really figure out, how many people in the United States had schizophrenia. And I understand that. But at the same time, too, I mean, it's okay to adjust, the way that you diagnose someone over the course of the years, and you learn things, because, you could easily say that almost everyone has some type of mental illness. And I mean, people should understand that, there's 7 different basic human emotions. I've talked about this before. There's anger, there's contempt, there's disgust, there's fear, sadness, surprise, and happiness. That's 7. So, depending on which way surprise goes, I mean, 6 out of those 7 are negative, right? Because we're wired to basically detect threats. So, when we're making, all these diagnoses, I think we have to be careful, because, some people are calling themselves depressed and some people are calling themselves anxious, when really, they're just not dealing with basic human emotions that they need to understand and need to deal with. Like, people are getting angry about being angry, or like depressed about being depressed. Like, if you feel one of these emotions, just kind of sit with it and just kind of reflect on it. And I think, that's a much, much better way to kind of tease things out. But, to come back to my original point, I think that, more people are understanding that, we don't just need to give out a pill for everything, and that, everyone shouldn't just be labeled as having a mental health diagnosis, because if things just keep, going the way they are, what's by 2040, it's going to be like 50% of people are going to have like a mental health disorder, right? People just need to understand that life is hard. You got to deal with these emotions sometimes. It's not that big of a deal. And that's why,
for some folks,
and that's
for
why,
some folks,
yeah, for
right?
some folks. And that's why I'm such a big fan of Jordan Peterson, because, he's kind of tough on people. And he said,
okay, but let me stop you there,
Sure,
because
go
Jordan
ahead.
Peterson was on SSRIs for years.
Yeah,
That's
he was.
interesting.
Yeah, he was for a long, long time. I mean, like for a long, long time, as was his family. And
Yeah.
what's crazy about him is what got him off is a carnivore diet.
I know.
It's an elimination diet where he
Yeah.
only eats meat with salt and drinks water, and he's
Yeah.
healthier than he's ever been in his life. And that is another massively controversial subject.
So let me push back a little
Sure.
bit, because I think people, as controversial as the book has been about cannabis and psychosis, this violence issue is even more controversial. And obviously, for a fair number of people, it doesn't really
doesn't sync with the stereotype.
It doesn't say, and it doesn't sync with how they've experienced cannabis use, right? So I think alcohol's a really interesting comparison.
Sorry.
Blame the Canadian.
Why do you have to go national on him?
we were talking about, my wife's actually from Newfoundland.
Oh, okay.
So
Right.
Newfoundland, as in understand.
Marijuana
No,
increases.
Newfoundland is how you say it.
Really?
You can't say Newfoundland.
I've trained myself to say it that way. You're telling me
No,
I'm wrong?
Newfoundland.
Look what Jamie just
Newfoundland.
pulled up. Marijuana use increases violent behavior. 50-year study finds casual link between cannabis and subsequent violent behavior. New research published online in advance of print of the journal Psychological Medicine concludes that continued use of cannabis causes violent behavior as a direct result of changes in brain function that are caused by smoking weed over many years. Researchers have long debated a possible link between the use of marijuana and violent crime. In contrast to alcohol, meth, and many other illegal drugs, the mellowing effects of cannabis seem unsuited to promoting violent behavior. However, ample previous research has linked marijuana use to increased violent behavior. The sticky problem in such studies are that many co-founding factors involved in interpreting this correlation.
So
Keep going.
Okay. It is very difficult to determine whether or not any statistical correlation between marijuana use and violent behavior are causally linked, or instead the two are associated through some other factors such as socioeconomic status, personality traits, or many other variables that are related to the propensity to use marijuana.
So I think that's a fairly good summary of the issues.
What's up, Jamie?
To add, the study came from 411 boys who were born in 1953 in London, 97% of which were Caucasian, and all of them are raised in two-parent households.
So those people are relatively stable if they're two-parent households.
Unless their parents beat the shit out of them.
That's also it's possible. But so I think the alcohol comparison is again a good one, because anybody who's ever been in a bar at 9 p.m. and gone back at 2 a.m. knows that alcohol disinhibits people, right? It causes fights, right? It makes people loud. It makes
causes a lot of fucking too.
It does. No, it really does, right? It's good and bad.
I don't know if that's good.
I mean,
sometimes it makes people's life
some
better.
people think alcohol and sex are a terrible idea.
right? I mean, it certainly causes some sexual violence
Sure,
too.
yeah.
So okay, but at the same time, everybody knows that you can have a drink. You can have a beer at the backyard barbecue. You can have a glass of wine at dinner. That's right,
sure.
and it doesn't mean that you're going to get in a fight.
And it actually might enhance your conversation, social lubricant, all that good stuff.
All that good stuff. And you might even know people. I mean, I do know people who I would say have a problem with drinking. Okay, but it's mostly they're sitting at home drinking scotch, watching baseball until they fall asleep that night. Now, that's obviously not a healthy way to use alcohol, but it doesn't make them violent. But we know on a population basis that alcohol causes violence. It causes drunk driving. It causes problems.
And it said that in the study that I quoted earlier, but it said that alcohol, again, they didn't, or sorry, cannabis, they weren't sure.
Right. So, okay. But so this is, again, I would like to read the paper that you're quoting from because I have so much other research. But here's what I'm saying about cannabis, okay? Cannabis, for a lot of people, they can just smoke it. And as people, as many people have tweeted at me, the only thing I attacked was a bowl of nachos, right? And so that's true for some people.
But that could be said with alcohol as well.
That's exactly
biological variability.
And there's so many studies that say that the cannabis laws have actually decreased crime. I mean, I'm looking at a study right now.
Wait. You gotta let me finish. You gotta let me finish. You gotta let me finish.
Let's let him finish.
Okay, go ahead, Alex.
So even though for many people cannabis isn't going to cause violence, that doesn't mean it can't cause violence in some people, especially,
or at least could be a factor,
especially with the kind of violence that I am talking about and that I write about in the book, which is, again, so alcohol. It maybe makes an argument into a brawl. It makes a brawl into something where somebody picks up a stick. It makes that into something where somebody pulls out a knife. It escalates.
Right.
Cannabis is different. Cannabis causes paranoia and psychosis. And it certainly causes those things temporarily, even if it doesn't cause them permanently.
So a distortion in reality that could lead to you doing something
terrible. And it's usually to somebody you're not actually fighting with. It's a family member. The worst cases that I've really seen a lot of these cases are basically innocent family members who are just in the way when somebody loses touch with reality and literally thinks like my 85-year-old grandmother is going to kill me, so I better stab her to death first. That happens. It happens a lot. And if you look at the amount of violence that people with psychosis commit on a population level basis, it looks like people with schizophrenia commit about 6 to 10% of all the murders in this country. And it looks like people with sort of more broadly defined psychosis, again, bipolar with psychosis, other psychotic conditions, temporary psychosis, they might be responsible for as much as 20% of the violent crime in the United States. That's a lot of violent crime. And what I'm saying is that it is quite clear that drug use mediates that violent crime. In other words, if you're not using, you can keep your impulses in check. But when you do use, you become dangerous.
So when we're talking about biological variability, if we factor in schizophrenia, essentially what you're saying is that there are people that have schizophrenia that don't commit violence, but that they're much more likely to commit violence if you add some sort of psych medication, whether it's marijuana, whether it's something else that perturbs reality for them, and particularly marijuana.
Antipsychotics bring down the use. But you said medication. So recreational drugs. The worst cases of all are cannabis and a stimulant. Because they both
like cocaine
or meth, exactly.
Yeah.
So when you get that, you get paranoia from two sources, and you get the only good thing about cannabis from this point of view is it kind of knocks people down a little bit, but meth brings them right back up.
So is it fair to say that what we don't know is that We don't know whether or not these people, like this young man with this terrible story from Connecticut,
Yes.
we don't know whether or not he would have become a schizophrenic and exhibited those symptoms without the marijuana. We really don't know, but we do know he did with it.
That's correct. And what I would also say is that for somebody like that, and this is quite clear on a population level basis with people with schizophrenia, is you got to discourage them from using.
Right.
They really have to be discouraged
Right.
because it brings out the worst.
Right.
And you know, somebody said this, a friend of mine, an old friend of mine from the New York Times said, so every time there's a hurricane, some people on the right say, well, you can't prove that global warming caused that one hurricane. That would have happened anyway. And they're right. You can't prove it. And you can't prove that any one case of psychosis was caused by marijuana. But when you look at the big studies, at the population level data, the association is really clear. And everything points the same way. And the synthetic cannabinoids, K2 and spice, those can clearly produce psychosis in people. And people with psychosis tend to slip back into it if they use. At some point, you got to start to say to yourself, why does everything go the same way?
Yeah, I also have a personal friend, and I really didn't think about this guy, but there's another personal friend that I know that is a martial arts instructor that had a psychotic break. He became schizophrenic, and he's a regular marijuana user, and the people around him associated that with that. And in fact, people that are regular cannabis users were trying to get him to stop using marijuana.
If you're
I'm not
close to
surprised,
being
Joe.
on the edge and you use a little bit of cannabis, for sure,
But let me tell you something. This guy
that.
was not on the edge when I knew him.
Yeah.
When I knew him, he was very rational, but something happened somewhere along the line.
Did he become a pretty heavy smoker over time?
I do not know because we don't live in the same area anymore, but he got really heavily medicated and did some really crazy shit and wound up being hospitalized.
Yeah.
And this was not the case before. I mean, whatever it was that triggered him, I mean, when I was around him when he was younger, I would have said he's a total normal guy, and I would have never saw that coming. He was a heavy marijuana user, heavy.
But
I don't know how he's doing now. I hope he's okay. But we have mutual friends.
Yeah.
And he became a schizophrenic.
And you will see cases like that, but when you do look at a lot of the larger data on cannabis and violence, I mean it's just not there. Like there's lots of data that suggests that medical marijuana laws, for example, can actually have a decrease in overall
They
crime.
could. But I think
there's a study that says that
gives no comfort to the people who lose their children because of these psychotic breaks.
That's right. And those studies are really bad. So the place that you can criticize.
Why are they bad though?
Because state level data is not great. The place the book has been criticized.
There was a RAND review though in 2013, and I mean that stated that
state
concluded
level
that
data.
marijuana use does not induce violent crime, and the links between marijuana use and property crime are thin.
Can we stop right there? I think we all agree that marijuana use by itself with people that aren't schizophrenic probably doesn't induce violent crime. But with people that are schizophrenic or people where it triggers schizophrenia, it could potentially induce violent crime.
Yes.
My friend did not get violent, although he did do a violent thing. It wasn't to a person.
Yeah.
I think we have to be really careful because there's no, just like with diet, just like with the food and, allergies, all these different variabilities when it comes to human beings. I think we have to be really, really careful about lumping all people together when it comes to how they get affected by various compounds.
Yeah. So the state level thing, if you want, so the place the book has been criticized, in my mind, sort of the most fairly is it points out that in the 4 states that legalized first, which is Alaska, Washington, Oregon, Colorado, if you look at 2013 and then you compare that to 2017, murders and ag assaults, violent crime, are up substantially in those states and substantially more than in the U.S.
Can I stop you there?
Yes.
But is there a possibility there's a correlation between organized crime? Because one of the things about selling marijuana is the people that have always been selling marijuana have been criminals. When you make things legal in a state, the people that were selling it illegal flock to that state, and that's been proven to be true. That there's a direct correlation between people being robbed. That there was also a significant problem with credit cards and banks, where everyone was having to do all their transactions with cash. There was a lot of violence that was associated with marijuana in regards to that, and also massive increase in population.
Yeah.
And that's part of the reason why Trump is actually not really against cannabis in some ways is because he feels that if we have medical marijuana laws, that especially the states that are border states, that the crime's going to drop tremendously, and it has dropped. They did a study last year, and it dropped over 15% in Colorado, and it dropped 7% in Arizona. And then again, Benjamin Hansen, who's an economist,
who used the wrong data set for his charge.
Let's talk over each other.
Okay, so he said that the murder rate did not demonstrate that marijuana legalization increases violence, and then it may have actually demonstrated that legalization slightly decreased violence. And he thinks that the reason that there was an increase in the murder rate, particularly in Washington, is because there is a large income gap. They say that Washington has the 10th largest income gap in the United States, and that's why.
How did that change, though, that corresponds to the murder rate?
Good question, Joe.
So I haven't, I didn't get to speak with Benjamin about this.
That sounds like confirmation bias.
Yes.
Well, if that is one thing that has been shown to, increase mental illness, like we talked about, and can definitely increase violence, is when you have an income gap. And
right, but how's the income gap shifted that directly correlates to the legalization of marijuana?
Because during the same period, the income gap, particularly in Washington, increased.
Okay.
So he feels that
in a corresponding number.
Right. So he feels that it's likely more to that. And I understand, but you have to respect this guy.
But I don't have to respect him because I know what he did with his data. And
tell me what he did with his data.
So Joe, this is maddening to me. Okay. Violent crime in those 4 states increased more rapidly than in the U.S. Period. Between 2013 and 2017.
Here, Jamie just posted this up here. Conjecture aside, no credible data exists that supports a significant association between the increased violent crime and marijuana legalization. Furthermore, studies suggest that, so far, violent crime decreases in states with legalized medical marijuana until new research credibly suggests otherwise. The claim that a demonstrable link between the two exists will remain classified as false.
Okay, so that's just not true. Okay, I know it's Snopes. Okay, and I know we trust Snopes.
I don't trust them that much.
Okay,
there's a lot. Okay. I was going to say that too, but they give all of their
sources
right here if you'd like to.
So again,
my data. What are these? Are you aware of these sources?
Yeah. I've read this stuff.
And what's wrong with them?
Okay, here. Let me just go back to what I'm saying.
Yeah, please do.
2013, Oregon, Washington, Colorado, Alaska. Mm-hmm. There are 450 murders in those 4 states. There are 30,000 ag assaults. Period.
Okay.
2017, Oregon, Washington, Colorado, Alaska. There are 620 murders in those 4 states. That's an almost 40% increase. There are 38,000 ag assaults. That's a 25% increase. If you adjust for population, you still get big increases. In Denver, 2018, almost 70 murders. There were about 35 in 2013. Seattle, 2018, there were 34, 35 murders. There were, I think, 19 in 2013. These increases are real. Okay? Now, can we say that marijuana legalization caused those increases? We cannot yet. There are other possibilities. And
what are those?
Well, first of all, population did increase. It's also possible that these states, quote unquote, imported violent crime. In other words, that you got a population of transients coming in part because marijuana was legal, and those people are likely to commit violent crime.
And on top of that, organized crime people that are selling.
Absolutely. There may have been some people who are exporting to Nebraska, to Minnesota, to other states. There's crime associated with that. But what I am saying is that unequivocally, the people who said legalization is going to decrease violent crime, and people did say that, and Cory Booker in 2017 said it, he said that it actually had decreased violent crime in states that legalized. And he didn't say it randomly. He said it when he was introducing legislation to legalize marijuana on the federal level. Those people are wrong, and they need to stop saying it. I know, and by the way, that Oregon economist used the wrong data set for his charts, okay? I used the real numbers, okay? The FBI homicide numbers. He used numbers that include justifiable homicides and police homicides.
No, that's not right. Because the FBI reported that the murder rate went up 1% from 2015 to 2016 as compared to the nationwide, which went up 7.9%. And then it dropped by 11.6% between 2016 and 2017.
Okay, with respect,
those are
Dr.
FBI
Hart,
numbers.
You do not know what you're talking about, okay?
Those are FBI numbers. I'm reading it.
You do not know what you're talking about. The numbers are clear, okay? I use the
I'm reading them right now.
Okay.
2016 release of FBI uniform crime reports from Oregon.
Okay. Yes, Oregon. You're not reading the reports from the United States. You're picking one state for 1 year.
Jamie's showing something.
That's the state
Reported
that has
violent
legalized
It's a
medical
slight
cannabis
increase over the entire country from that time period too. So
Yes.
to pick those 4 states where marijuana was legalized is sort of cherry picking data.
No, it's not. It's picking every state where they were legalized and comparing it to the whole country.
The whole country erased.
But the
Yes,
whole
but
country
the
is
whole country's-
similar? Is it a similar
didn't- no,
increase?
That's what
No.
that's what I'm trying to show.
Yes.
If I'm
Okay.
trying to show
Okay.
something wrong,
Okay,
then
but pull back so we can see the whole
So
thing.
first of all, that's violent crime, not
Reported
murders and ag
violent
assaults.
crime
would they
rate.
not be in there?
Well, violent crime and
that-
ag assaults, aren't they?
No, so the 4 categories of violent crime are murder, ag assault, robbery, and rape. Rape has sort of gone sideways the last few years. Robberies actually have gone down. It's murders and ag assaults that are interpersonal violent crime. Okay, just to go back to this Oregon economist, because this maddens me. He used a data set that is not the standard data set to report murder rates.
What is the difference?
He used a data set that includes justifiable homicides, meaning I'm in my house, you come in, I shoot you and kill you. The police don't charge me with anything.
Right.
And police homicides.
But the data sets you use in your book
Please,
aren't even
let's
published.
not interrupt.
Let me finish. Those 2 categories of crime are not likely to be impacted by cannabis use. Cops are not smoking when they're on patrol, I hope. And if you are using, you're very unlikely to have your murder viewed as justifiable homicide. The fair comparison is the base murder rate in the U.S. And that's the number that I used. And I am telling you, I know these numbers. I sleep, I wake up with these numbers. Cannabis, the 4 cannabis legal states on a per capita basis, crime murders rose 31% on a per capita basis in those 4 states over the 2013-2017 period. Maybe, I'm sorry, I said 31, maybe it's 29%. So maybe I say I woke up with... Anyway, for the U.S., it's 18%. 29% versus 18%. That's the gap. And I am not saying that I know that cannabis legalization caused that gap. What I'm saying is people need to stop claiming that cannabis legalization reduces violent crime. It has increased in those states.
Can I ask you, in those states, was it universal, the increase? Was it almost
Yes.
identical?
Yes. Alaska was the most. Then I think murders went up more in Washington. And what's also interesting, Joe, if you really want to go into the numbers, is the gap actually widened year by year. So that's sort of what you would expect if this is the result of a psychomimetic effect. In other words, a psychosis-causing effect. Because cannabis doesn't cause psychosis right away. People break down.
Right.
But if it's causing heavy use and some of those people are sliding into paranoia and psychosis, you'd sort of expect the gap to increase over time, and that's what's happened.
Okay, so I'm going to go back again to the Netherlands, okay, because they've had cannabis legalized forever, and they have 1/5 of the homicide rate that the United States does.
Right, but they also have a lower cannabis use.
That's true. They also have very few guns.
But
Yes.
still, one
There are a lot of
fifth.
kickboxers, though.
They do a lot of kickboxing. But 1/5. I mean, it's pretty drastic overall. And again, Alex, I
Right,
appreciate some of the
when we're talking about
Sure.
the correlation between cannabis use, one of the things that we have to accept in America is that when you're in a place like the Netherlands that has a long and accepted history of use, people are accustomed to it. So I think things kind of even out. I think one of the things that we're dealing with the United States is people that have just they don't have
Never
a long
used it.
history of experience, and it becomes legal, and then they use it, and maybe some of them, like we're talking about, don't have a tolerance for it, have too much. And like I was talking about with my friend, who's like this really the one who had an edible and became suicidal and was fucked up for weeks. Guy's very confident, very articulate, very intelligent. He's not a weirdo, not a transient, extremely successful. I think there are variables that we need to take into consideration, and there's certain human beings that exhibit a pattern of behavior that's directly correlated to cannabis use that I don't experience. So if I could say from my own personal biases that that's bullshit, that's nothing, it doesn't do anything. I've been smoking for years, it doesn't do shit.
Well, you probably don't have one of those 3 genes that we were talking about earlier.
Yeah, you're clearly pretty psychiatrically healthy.
And you probably also, too, don't overuse or you have some type of, legitimacy as to why you are using it. And, one, I want to keep going with this, but, at the end of the show, I think that we should make some type of like recommendations for people, just because I hate when, you have this big, 3-hour podcast, and then at the end of it, it's just like, hey guys, just be safe. I think it's like let's have some.
That's so true.
Have at it.
Good luck, you fucks.
It's like let's have some type of like recommendations. Like I love the podcast with Cresser and Joel, right?
Mm-hmm.
But at the end of it was just sort of like, hey guys, don't eat the American diet.
I think most people realize that one person was going on data and the other person was,
Yeah.
Joe, I mean,
sure.
I find it so fascinating that now when you think back through your life, you've thought of somebody who was affected.
I have several people.
I'll bet as you think about it, you'll think of more people.
I maybe, but those are the big ones. And like I said, my friend who is a martial arts instructor, it was a pretty significant issue with a lot of our friends. We were trying to figure out what was wrong with him beforehand. He was sending me these videos that didn't make any sense. And I was like, what in the fuck is this? Like, I'll explain to you more off air so I don't have to out this guy. But a lot of people that were close to him were really seriously concerned. Now, is it something that would have happened anyway? I don't know.
We don't know.
How old was he?
He's in his 20s.
Late 20s?
How old exactly?
Late 20s, 20,
That's right around the age. So,
well, it's sort of,
it is a little bit late-ish. Like, because like I said, a lot of the studies, even when you look at the ones on adolescents, like for sure, it's below. Like they have done studies like below 18 is worse than say below 25.
Yes.
Below 15 is worse than say 18. Like the younger you go, the worse. And
he seems to be fine now.
That's good.
That's good.
Is he using now?
I don't know. I have to find out.
And it's I'm not an expert on this subject, but it's because of this of something called pruning that we go through. So everyone goes through this, and basically through your adolescence, you're going to drop off some weak neural connections to kind of pick up some stronger ones. It's the best way to kind of explain it. When you use cannabis, you can potentially accelerate that process. And then because you accelerate that process, you don't get those good neural connections. And then, people unfortunately, develop things like psychosis and schizophrenia. So, that's kind of where the issue lies. So, one thing that I am very happy that we're talking about, and I know Alex will be too, is that we want to discuss the benefits in this podcast, make sure that people understand that I believe that marijuana is medicine. It's an excellent medicine. But the other thing though too is we do want to mitigate the risks, because there are real risks out there. So, I do appreciate, us talking about adolescents and making sure that they do stay away from cannabis.
Yeah. And especially that's like, I read these, these cases, the case files sometimes, and, the kid started using when he was 11, and, it's like that kid never had a chance, right?
Mm-hmm.
I mean, and obviously oftentimes these are kids coming from disadvantaged backgrounds anyway, but they're using by 11, and at 16 they put a gun to somebody's head and pull the trigger. I mean, the pre-adolescent and early teen use, we got to do everything we can to stop.
The problem is, like if you smoke pot in junior high, like say 7, 8, 9, like you're probably going to smoke pot in high school.
Yeah.
Like that's that's what I saw when I was growing up. And even when I was home for Christmas for a few days, like a couple of my friends even talked about some people that we knew smoked a ton of pot in high school, and like now like they're crazy, or they're not really doing too much. So
but
you do have to be careful with that.
I think we're dealing with a lot of ignorance. We're dealing with a lot of ignorance when it comes to biological variability, right? We don't really understand how a lot of these different things affect people, including like just diet and what causes depression. Like how much of what we constitute or what we decide as depression is inflammation, poor gut health. There's a lot of variables. There's a lot of them. Marijuana is absolutely one of those variables. And again, I don't have an issue with it. I like it. I love the stuff. but it doesn't fuck with me.
Right.
But I'm also honest. And so I see these people where it's pretty obvious to me that something's going on and that marijuana is not a good idea for them. And I just think, like I said, in the past, I myself have been guilty of using this sort of blanket description of it as being a positive influence and that it's a good thing for people. I don't think it's a good thing for everybody.
No, it's definitely not a good thing for everybody, and it's definitely not a good thing for the people who have those genetics that I discussed earlier. And also too, if you need to have some type of self-awareness, like the people who don't do well with cannabis, you shouldn't have to have your friends tell you that. Okay, man, you're not doing too well with this. Right. You should be able to figure out yourself. But
that's hard for people. I mean, that's one of the most difficult things for people to do is self-assess. To be objective.
And that it's I've heard from a lot of people who used heavily and seen other people who've used heavily in the last month. And I think it's very interesting why people continue to use when they're getting paranoid. Mm-hmm. And the most cogent argument. And again, I'm not, I smoked a handful of times in college and after college. I actually don't think I'd be comfortable using high THC cannabis now, knowing what I know. But anyway, so the people, the most.
I got some right here.
Okay, I'm going to get hotboxed.
I'll give you the shit that put Elon on the
moon. but the most cogent argument. I thought it was so interesting. This guy said, well, my friends, I would talk to them and say, I'm paranoid now, but I'm going to smoke through it. I'm going to smoke so much that I'm almost comfortable being paranoid. And I think that's a dangerous thing to do to your mind. Because you're sort of counting on being able to step back from that and stop using.
Yeah, that's a silly way of looking at it. I think that some of what we call paranoia, just normal paranoia, is hypersensitivity and hyper-awareness and awareness to a lot of things that you're putting off in the back of your head because in order to function as a normal person and get through this life, you can't really be aware of everything. Otherwise, you'd be
you're paralyzed by fear.
We're in space, okay? We are on a gigantic ball that's spinning 1,000 miles an hour, hurling through infinity. This is reality.
Yes. An asteroid can hit us and take us out.
Thin layer of gas that's protecting us from everything that's flying around in our solar system.
And by the way, at best you get 85 years, and then it's all shit anyway.
Right, and even if you make it to 100, the last 15 is dog shit. Right?
You can't think too much about this stuff.
Maybe the stem cells and stuff will be too bad.
Maybe you're going to live to be 300. Whoop-de-doo. The universe is infinite. You're going to die. The sun is going to end. At the end, imagine if people do live to an infinite number, we realize our fucking sun is dying. You're going to freak out about that. It's all relative, right? So there's only so much you really can think about, and some of what paranoia is this hyper-awareness of all these variables that you really haven't considered. And then also, what we were talking about before, the things that can be beneficial, the hyper-awareness of how you communicated with people, and maybe you could have done a better job with that. Maybe you came in hot. Maybe you were upset about something else when you ran into them. You were already at a 7, and they brought you to a 10, and it was totally unnecessary. Within a normal situation, you would have only been at a 2. Those things are real, and sometimes marijuana helps highlight all the errors in your way. I think it can be a tool, but my description of it is like any other tool, like a hammer. You can build a house with a hammer, or you could just hit yourself in the dick if you're fucking crazy. And this is something that I think we should consider when we're discussing almost any psychedelic medicine. And I think that I really do believe that marijuana is a psychedelic, and I don't even think it's a mild one, especially when it's in edible form. I don't think it's mild at all.
Yeah, there's some people that come in to my office, for example, and just when I meet them, after 1 or 2 minutes, I just got to decide in my head, this person's not using THC.
Right.
This person is anxious.
What gives you that? Is that what it is? Anxious?
Yeah, it's just a feeling of they're not someone who can just sit and kind of be by themselves. They just kind of give me the impression that they're not going to do well with cannabis, because if they have any type of change in their psyche, they're going to see that as bad. That's bad,
Right.
And you got it when you're using cannabis, you have to be someone who knows that, okay, I'm going to get a little bit of maybe paranoia now, or at least my psyche is going to change a little bit. I am using, psychoactive substance, and not be able to freak out, right? But some people, I know that if they use a little bit of THC, they probably would have a freak out. They probably would have a bad experience. Generally, it's people who are, very, very fearful. Now, the other side of that coin, though, is that if you use CBD, and like we discussed earlier, that can decrease learned fear, right? So that's something that's really helpful for those patients. But, I do agree that, we have to be careful about using high THC in certain groups of people, for sure.
I think one of the, and it's great to hear Dr. Hart say this, one of the real disappointments for me with this book has been, really the biggest disappointment for me, has been that the DPA, the Drug Policy Alliance, and that some of the other advocates, they just want to yell at me. And they want to say that I don't understand correlation and causation and that I'm cherry-picking studies. Let's acknowledge that a lot of people use this drug. And that's true whether it's legal or not. And let's acknowledge that probably in 2020, certainly if there's a Democrat elected, most of the Democratic candidates have said they favor legalization. Legalized cannabis will probably be the law in the United States, okay? And let's talk about what we're going to tell people who are using. And I had this roundtable with the executive director of the DPA and some other people. This was about a month ago, shortly after the book came out. And I proposed what I thought were really common sense warnings. And she basically wouldn't agree. I mean, she agreed to like one of the 5 of them.
What were the warnings you proposed?
It was stuff like, if you have a family history of severe mental illness, you probably should not use cannabis. You should not use or try to delay your use until you're in your 20s, I think was one of them. And one of them, I thought, I couldn't believe I was getting pushback on this, was something like, if you're having strange thoughts, especially paranoid thoughts while using cannabis, the drug may be increasing your risk for severe mental illness and you should not use it. I mean, I think if, now look, we can argue about how severe is, right? But certainly if you wind up in the ER even once, that's a bad sign. Yeah. And I just don't understand why the legalization community. Look, I can understand why people who are selling this drug don't care, right? We know if tobacco has taught us one thing, it's that when you're selling a product, you will sell it to people even if it kills them, okay? But I don't understand why these people who are supposed to be science-driven and supposed to be thinking about the greater good won't agree to reasonable discussions about what the warning should be on this.
I think you did yourself a slight disservice by not including some of the beneficial aspects of cannabis. I understand your perspective. I understand why you were doing that, because you really wanted to highlight the dangers. But I think that's one of the things that they can point to when they say you cherry-pick data. But I think that also it's really important to, when you're having these kind of conversations, to have a long one. I mean, we've really covered the full gamut, right? And I think that's probably one of the reasons why Bill Maher didn't want to have you on, because he's got 5 other people on the panel. Everybody's talking over everybody, and you have 5 minutes to get your case out. And I don't think it's possible.
Yes.
I think this is a long, complicated discussion that has to do with biological variabilities. It has to do with unique situations with human psychology, the way the brain functions, whether or not it can act as a trigger to schizophrenia, where someone may not have ever experienced that trigger without it. Maybe if they just became a long-distance runner and they would have lived a healthy life with no psychotic breaks at all. We don't really know, and unfortunately, once someone goes off the deep end, we might never find out.
Yes.
And
sorry, go on.
No, I'm just saying I think we have to be very careful in saying we know what it does. We know what anything does, because you don't know. You know what it does for you. Some people can't eat fish. They eat fucking shellfish and their throat seizes up. There's so many variables when it comes to the human body, whether it's your genetics or what you've eaten in the past and how it's shaped your gut biome. There's so much that we don't know and don't understand about how we interact with all the various substances that we take into our body.
Yes.
Yeah. One thing though too, I noted in your book, Alex, is that you said that you didn't think that cannabis can help the opioid epidemic. Is that true?
I certainly don't think it's a good idea for people who are at risk of opioid use.
Okay, so I have seen a lot of people in my practice come off of opioids with cannabis use, and there are various medical studies that do show that people who use cannabis can replace opioids with cannabis.
A lot of folks feel though that that's in defense of that's just a patch, and that really the best way to get off of opiates is ibogaine. And that ibogaine, just the repeat rate of addiction or people try it again afterwards is really low.
I think one of the things with that is just the accessibility, the affordability. Like, I've never administered Ibogaine before.
It's just because it's illegal in the United States, but and it's a particularly ruthless medication that I've never tried personally. But the people that I know that have tried it have had spectacular results, especially people that have had problems with pills.
Yeah.
In fact, a friend of mine, my friend Ed Clay, he opened up a clinic in Mexico based on his own interaction with pills. He had an injury, he got hooked on the pills, and really had a fucking problem. So went down to Mexico and went through an Ibogaine session and cured him. Just whacked it out. It literally changes the way your brain interfaces with your addiction. It's not simply a perspective enhancer. It changes how your body and your brain deal with opiates.
I think Tim Ferriss has actually talked about that before as well.
Yeah.
But I've seen it in my practice, and there are medical studies. So I don't think that we should throw out the fact that cannabis can help the opioid crisis. And then also too, you want to look at it from a clinical perspective, right? So we know that opioids can kill people, right? Because it acts on the brainstem, whereas cannabis doesn't. So you might be saying, you're just substituting one for the other. And, sometimes that is true. But if you're using a less harmful substance, to me, that's like a huge win,
yes.
Right? So if someone, has to drink, 12 beers a night versus smoking like one joint, man, that's awesome. And you look at all these clinics, like you look at like methadone clinics. What are they doing? They're trying to get people off one substance to, a substance that is a little bit less harmful.
Yes.
And I think that when you use cannabis, it can be effective for opioids. It can also be effective for benzodiazepines and for other medicines as well. So, it would be awesome if everyone would just, feel happy and great all the time by just exercise and nutrition. And, that's what I advocate, and that's what I try to do personally. And that's what I try to, say to my patients all the time. But I understand though that, sometimes life is hard. Sometimes, things hit you. You have crisis in your life. You have, personal crisis that can, throw off your mental health. And then you get into a car accident, and you could be in really severe pain. And in those times, sometimes diet, exercise, meditation, doing all the right things just isn't quite enough. And, I think that it's great that we have cannabis for those situations, because it does seem to be, very effective and has less side effects compared to some of the other medicines, that we have traditionally used. And, even though, I'm talking about opiates and deaths, we can also talk about NSAIDs, right? Like non-steroidal anti-inflammatory drugs. So, these drugs can also, wreak havoc on your GI system. I saw one study, actually, I tweeted out, Rhonda Patrick tweeted out, said that if you use NSAIDs, it was really short. I got to look it up again, but it was like 2 weeks. It can decrease your gonadotropins, which can stimulate your testosterone level by like 25%. And on that note, too, we should talk about, I can't believe I forgot to talk about this, but opioids can drastically inhibit your testosterone production, right? Which is a huge thing for depression. Because I've had guys come in to me before that have been really, really depressed. You just give them a small amount of testosterone, and man, they're off their antidepressants and they're off to the races. They're doing great. So are we creating a lot of people who are depressed because they're using opiates and their testosterone levels are low? And for men, having low testosterone is horrible. Your libido goes, you're going to have low motivation. You're not going to feel as well. You're not going to want to do things. So, if you're giving someone a medicine that nails their testosterone levels down, that's going to really, wreak havoc on their mental health. And I just want to make a note too, because Ben Greenfield, who again I really, really respect, I like that guy a lot. Was talking a little bit with you about testosterone and cannabis and how it can drop it. So I think there was 3 studies I saw done on humans, and 2 of them noted no statistical difference in drop in testosterone levels, and the other study noted a small statistical difference. So I think that it may drop your testosterone levels a little bit, but it's not going to, substantially drop them. So just so people know that, because I know that comes up all the time,
Yes, as the dumb anti-drug advocates like to say, doobies cause boobies. Right?
Oh yeah,
that is not right. There's no gynecomastia associated with that.
I'm joking. Right? Risperdal causes boobies, but that's a different issue. Risperdal is an antipsychotic.
Risperidone, yeah.
So look, I think the issue of whether cannabis is a gateway drug, it's 100% clear that cannabis is a gateway drug. The argument is why.
Did you say it's 100% clear?
100% clear. The argument is why. Okay, so it's quite clear that cannabis use oftentimes precedes other drug use, whether it's opioids, cocaine, other drugs. Now, one argument, and this is actually a pro-legalization argument, is one reason it's a gateway is that if it's illegal, you got to buy it from your friendly neighborhood dealer. He might have access to heroin or cocaine, other drugs. And so eventually maybe you decide to try one of those other drugs. So actually that's really why the Dutch legalized. They wanted to create an avenue for people to use cannabis that wasn't connected to other drugs. Okay. Another possibility is that using an addictive, intoxicating substance, you might like it and you might want to try other addictive, intoxicating substances and it might prime your brain. And then the third possibility really is that there are just some people who are risk takers out there, right? They're going to use cannabis, they're going to gamble, and cannabis is a little bit easier to access than other drugs, so they're probably going to try cannabis first. So it's not really that cannabis drives the use, it's just that cannabis is first.
They're just curious people.
But what's your thoughts on
well, what I will say, I'm just going to go back to the NAM report, right? I mean, you quoted these people in your book. So this committee couldn't find sufficient data demonstrating an association between cannabis use and initiating opioid use. They found no compelling evidence to support the gateway drug theory.
So again,
but those are the people that you quoted in your book.
So there's been more research done since then. But
things have radically changed?
I would say things have changed some. Here's what I would rather say. I think that probably it's a combination of these things, right? There's certainly an environmental factor where, again, if you're buying from somebody who's got access to other illegal drugs, maybe you try those drugs. At the same time, getting high feels good, and maybe you want to try other drugs. And at the same time, you're just a risk taker. Okay. What nobody seriously ever said until about the last 5 years is that cannabis could be an off-ramp for opioids, okay? And there's a lot of reasons to believe that's a really bad idea. First of all, cannabis, if you actually need opioids for pain relief, cannabis is not a good enough pain reliever. It's like alcohol. It's a mild pain reliever. It's not strong enough. If you're dying from cancer, cannabis probably is not the pain reliever that you need. You need opioids, okay? And the state level data is not as good. If you want to really figure out what's happening to an individual, the best way to do that is to follow that individual. And there's a really good paper that came out in 2017 after the NAM report, so they didn't have it, that shows that people who used cannabis in 2001, this is based on a large national study in the US, were 3 times as likely to be using opioids 3 years later. Okay, and that just intuitively makes sense to me. And the other thing that people on the legalization side don't ever talk about is who are the 2 countries that have the most cannabis use in the West? The U.S. and Canada. Who are the two countries that have by far the worst opioid epidemic? The U.S. and Canada.
Okay, but there's a real issue with that because the United States is also the only country other than New Zealand that allows pharmaceutical companies to advertise.
Sure.
I mean, but
Canada doesn't.
The amount of opiates that are prescribed in the United States is fucking preposterous.
I agree.
Particularly I don't know if you ever saw the documentary The OxyContin Express, but the way Florida used to be structured, where they didn't have a database.
Yep. And you could just literally go from pharmacy to pharmacy. Yeah. No, we have a problem with the way we prescribe drugs in this country. Opioids, ADD drugs, benzos, SSRIs, all of them.
And we're connected to Canada, so it makes sense that it would filter over there.
Yes, but what I would say is the people who think that cannabis is not part of that over-prescribing problem are deluding themselves.
And what do you think to that?
Sorry, can you repeat the question again?
So I agree with Joe. The way the access to opioids in the U.S. I mean, certainly it's come down a little bit in the last couple of years. But Purdue Pharma, there's a special place in hell for those guys. But it's not just opioids. We prescribe too many benzos. We prescribe too many ADD drugs. We probably prescribe too many SSRIs. We prescribe too much in this country.
I think we all agree on that.
I agree with that.
And I think that cannabis is another example of us looking for a drug to solve our problems.
But what I'm again, just from a clinical perspective, I can't just rely on diet and exercise for all my patients. I have to use other tools.
Sure.
And again, like everyone here in this room, like we're all pretty healthy. I don't have a bad back, or I don't have a mental health diagnosis or anything going on. So I have to look at patients that are coming to me, right? So the way I see it is that we just mentioned a bunch of other drugs, antidepressants, amphetamines, all these types of things. Cannabis, and again, I'm going to separate the THC and the CBD. It's an incredible medicine, and it doesn't kill people, right? So as a clinician, that's so comforting for me to know that every single night I go to bed, I killed 0 people. I know that, right? So that's really, really comforting for me to know. Also, I feel, we were just talking about amphetamines and we were just talking about, SSRIs. I feel that cannabis, particularly the CBD component, can actually be more effective. That's what I've seen a lot in my practice, and other people have seen that as well. So, I think that we need to take that into consideration when we're using all these drugs. And Alex, some of the things that you're saying, they're quite, admirable, and in a lot of things like researchers say, are quite admirable as well. And they feel that they can, tell clinicians, give them really good advice, but they're not the ones in the trenches. They're not the ones in front of the people. They're not the ones that have to chat with patients. I have an obligation to do something for my patients to make them better. I really feel, we just listed a bunch of drugs, that cannabis is a really, really effective tool, and it doesn't kill anybody. So, because of that, I'm gonna keep using it. But like I said, I'm always looking for other drugs. I'm always looking for other, alternatives to also help my patients. But I think that, using cannabis is a really effective tool for a lot of clinicians, and it's helped a lot of patients.
But what do you think about his argument about it being a gateway drug? Other than what these people said in the study, that there's no evidence that supports that it's a gateway drug, what are your personal feelings about that argument?
So I don't feel that that cannabis is a gateway drug. I do feel that, one of the things that you mentioned earlier is that, some people kind of have this personality where they're like an experimenter, right? And they just want to try something. So, the fact is that alcohol and cannabis just get introduced first most of the time. Right. Most people, don't do, Coke or LSD and then hey man, let's try some cannabis, right? So it's just that's the very first one there. So you could say anything that was easier access. If there was some new drug that, did something similar to alcohol or similar to cannabis, and that was introduced in our society, you'd be calling that the gateway drug. Well, and I do feel, and I do believe
alcohol has clearly been demonstrated as being the gateway drug to almost all hard drugs because of the loosening of inhibitions, whereas the opposite could be said about cannabis, that it makes you paranoid. You might actually be less likely to try cocaine afterwards.
And I know that the name, they don't feel that cannabis is a gateway drug either. I mean, again, they said, they found no compelling evidence to support the gateway theory. And again, I mean, these are the people that you are quoting in your book, Alex, again, right? Let me just go a little bit further. They said in a retrospective cohort study, Mayett from ETAL and the 2016 examined the transition from cannabis use to the use of other illicit drugs. They found that the probability of initiating other illicit drugs after cannabis did not differ significantly from the probability of starting with other illicit drugs. So it's just that cannabis is there first. It's definitely not a gateway drug in any stretch of the imagination.
Again, I totally disagree. And there's 50 years of data on this. I know the studies that he's quoting, but there are many others. And I think the argument is as to why. And again, I think the argument that to some extent having access to this drug via illegally tends to open you up to other illegal stuff, which to me is an argument for legalization. So, but I do want to throw one thing out there. I don't know how many of your viewers have teenage kids, or they're probably more likely to be teenage kids than to have teenage kids. But the book has the one thing that really worries me if we're talking about gateway drugs is that Juul and vaping are really a gateway to THC vaping. So you can
Why do you say that?
Because, well, first of all, it gets kids, teenagers used to inhaling, this illicit substance, and you can actually retrofit a Juul pod with THC. They don't sell them, but you can easily go online and look at how to do it. And I think it really worries me, and I've heard from a lot of parents in the last month that there is an epidemic of nicotine vaping and THC vaping going on right now. And that, I think, and we're talking about 15, 16, 17-year-olds inhaling pure THC, the most dangerous form of this drug. And I think, unfortunately, it's not going to take long before the mental health consequences of that become apparent. And I really do hope that the book gives parents some tools to talk to their kids about that, if nothing else.
Last words?
I was actually wanting to go over a few things that maybe I thought you might be interested in.
Okay.
Okay. So, you're a dude, you're over 50, so prostate cancer. So, it's been shown that CBD may actually be beneficial for prostate cancer. And one thing within that too, within the same study, they actually found that people who used CBD and were on chemotherapeutics has actually augmented the efficacy of
When
the
you say
chemotherapy.
good for prostate cancer, do you mean to prevent it?
Yes.
Do you mean to treat it?
Prevent and treat. Yeah. Yeah. And then they say, THC may actually be a little bit effective because it can, and this comes back to testosterone a little bit, it can antagonize DHT. So DHT is another testosterone, hormone, as you know, and that's, more linked to prostate cancer. One thing too, we didn't really get to talk about was CTE and concussions. I know a lot of your viewers are into MMA and all about that. And I tweeted out a study the other day that you retweeted. I really appreciate that. And just, it was a 3-year study, showed that the mortality rate overall was 9.5% for people who had suffered a TBI. People who tested, I know, we talked about correlation causation, but, the THC users only had a 2.4% mortality rate. The non-THC users had 11.5% mortality rate. I mean, that's really, really significant, right? Like, it's
And
over
this
like
is
5
just
times.
THC and not CBD, because
Right.
CBD has been shown to be very beneficial for people with traumatic brain injuries.
Yeah. Yeah, exactly.
So CBD and THC are both beneficial?
Yes. So that was, again, a correlation equals causation. But I mean, that the stats are so overwhelming. Like if it was, non-THC was like 3.5%, I would have bring it up. But it's 11.5% compared to 2.4%. And again, CBD, yes. And there's even, mechanisms of action have even been identified with that. It decreases, inflammation in your brain post-concussion. One last thing too, again, there's only one study on it. So, and it was done on rats, but I'm a keto guy too. But the study on rats, interestingly, showed that if you do have a high fat diet, that you can actually decrease sensitivity at the CB1 receptor. And they think that that's just because there's an increase in your endogenous cannabinoids, 2-AG and anandamide when you do have a high fat diet. And then, can I maybe keep going? Okay, sure. And then Alzheimer's, again, I know you're plus 50, so THC. It can,
Say Joe has Alzheimer's?
No, I'm not
coming.
saying-
It's probably on its way.
I know that he wants to keep doing this podcast, for forever. I
Maybe
think.
that'd be an excuse to stop.
So THC has been shown to inhibit the formation of beta amyloid plaques. So that's the the hallmark of Alzheimer's disease. And then CBD has also been shown to be effective for Alzheimer's disease as well. There's a rat study that I was gonna get into, but it's fairly detailed. So it might be best just to say that it can help with rescue memory in patients if you do use CBD, meaning that it may actually reverse, and that's been shown before too. They've done that in mice.
I got to interrupt you for 1 second, okay? And I think you would agree. This data is some of it's sort of epidemiological, some of it's preclinical. It's very, very early. None of it really proves much.
Again,
but
Alex, just let me say, I'm a clinician, okay? If someone comes to me and they have a concussion, it's very frustrating just to say to them, hey, physical, cognitive rest, go home, okay? It's really frustrating to say that to someone. Also, to, the high-fat diet thing, Joe and I both follow, a very, very similar diet, so that's something that I want to share. With regards to, the Alzheimer's disease, we have really, really poor medications for that, and we have an aging population. So again, like Alex, like you want to look at everything, which is what I'm doing. Like I'm looking at everything and I'm trying to make a clinical decision. Am I using some things like without, randomized control trials? Of course I am. But again, I'm a clinician, so I'm using, mechanisms of action. I'm using what I see in clinic, and I'm using epidemiological studies, and I'm also taking into account what other medicines do I have, based upon all the data. This seems to be an effective treatment.
And I am absolutely not saying that you as a clinician shouldn't do that. Especially you're in Canada, cannabis is legal. You should use your best judgment. What I'm saying is that when we're talking about policy decisions around cannabis and THC, and to a much lesser extent CBD, the advocacy groups have seized on this very, very preliminary data to say a lot of things about cannabis and THC that have not been proven. And, a guy I know named Peter Bach, who very smart, he's a pulmonologist. He's at Memorial Sloan Kettering in New York, and he wrote a piece in the Wall Street Journal a couple weeks ago talking about cannabis's limits as medicine. And he said something that I thought was so well put, which is the reason why people want cannabis to work for Alzheimer's and cancer and a bunch of things where there's really no evidence that it works is that we don't have good treatments. We want cures. We want help. If we're clinicians, I'm not a clinician, you're a clinician, want to be able to give people who come into our offices something. But that hope is not a substitute for science. It doesn't mean that it works. And even you want your patients to have hope, okay? But the advocates, the people who are using this to push, especially to push THC and to capitalize on the public confusion around THC and CBD, I think that is a real disservice to people.
Okay. Listen, I think we covered everything. It's a complicated subject. It really is. And I think it's really important to discuss how complicated it is. I don't think there's I've never heard such a detailed analysis of all this stuff in a way where you can get two opposing people that are, very civil about it, but agree on certain aspects of it. I think we really highlighted all those things.
Joe, thank you so much for having us.
Thank you, guys.
Thank you so much. Really appreciate it.
Dr. Hart, thanks for
give out your social media, please.
Sure. So I'm at Dr. Mike Hart on Twitter. I'm at Dr. Mike Hart on Instagram, and I'm at Dr. Mike Hart on Facebook. So it's DrMikehart.
And Alex, your book is Tell Your Children. It's available now.
It's available everywhere. It's available now. And if I had a copy, I'd give you a copy.
That's okay.
I'll give you the copy I have.
Okay, all right. Well, thank you guys, both of you. Thank you very much.
Thanks.